Hello there. Thank you so much for coming in today. This is your first appointment with us, correct? Can you just confirm your name and birth date? Okay. Well, it's so nice to meet you. I'll be your doctor today. And it says on your chart you've been having some trouble seeing far away as well as close up, correct? Yeah, well, don't worry. It happens, and we can definitely adjust things for you, make it easier to see. So I just want to run some tests and ask you some questions, if that's okay. All right, perfect. So when's the last time you've been to the eye doctor? Okay, so it's been a while, and you're new to the area. Well, welcome. We've been here for quite a while. We've moved buildings a couple times, but just like down the block, so. Alright, but it seems like we'll probably have to just redo everything. We'll want to give you a pretty comprehensive look over and testing to get your prescription back up to date. So do you wear contacts or glasses already? Did you bring your glasses? And how are they treating you? Okay. And those aren't strong enough anymore, especially on the one side. Okay. And when were those prescribed to you? Okay. All right. Would you mind if I took a look at your glasses? Thank you. I'm just going to take a look at the prescription of these. It's going to give me a little bit of a starting point. I know that these aren't working for you, but it's nice to gather all the information I can. These are some nice frames, though. Took really good care of them. Okay. Get those tested. And in the meantime, I'm going to just examine your eyes for anything glaring. So have you been experiencing any pain? Headaches? Okay. And with the headaches, are they frequent? Okay. Do you remember when they started? Okay. Well, hopefully, what we do today should help with that. Okay. Any redness or swelling around your actual eye? Itching, burning? Okay, great. How about any eye twitching? Cloudy vision? Double vision? Okay. And to your knowledge, there hasn't been any trauma to your physical eyes? No bumps, cuts, anything like that? Okay. Alright. Okay. So I'm just going to put my hand here so I don't accidentally bump into you. And I'm just going to take a look around your general eye area. Make sure there's nothing glaring. Good. And the other side. Good. Now, if you would go ahead and look at my nose. Good. And continue looking at my nose. Perfect. Okay. You look good. Nothing very concerning on the surface. So we can move on to addressing your actual prescription and updating that so you can see a bit better. Yeah, absolutely. So, what I would like to do is put on some trial frames. This is going to determine prescription for future classes. We have the option of contacts, and I want to adjust these to your face perfectly, because if they're skewed or angled or not sitting correctly, it can actually affect the prescription that we end up with, so we want this to be accurate. So I'm just going to take some measurements. I have a little ruler here on the back of my portable eye chart, and what I'm going to do is just place this ruler here. I'm just going to measure from the corner of your eye over and then down the middle. And then I want to measure the temple area. Good. And then the other side, of course. Okay. Perfect. It's equal, which is always a good sign for symmetry, if you care about that sort of thing. Okay, so these dials will adjust the sizes. I know it looks very complicated and scary, but it's just a pair of glasses. But they need to be able to be adjusted per patient. So we want this to sit about 35. And then the nose bridge, we can adjust when we get that on your face. So if I were to slide these on, is it sitting on your nose? All right, let me just turn. There we go. Is that a little better? Okay. Okay. All right. So let's get these on. And what I'm going to do is take our trial lenses here. And these are going to go into the frames. And we'll be able to make adjustments from there using the chart in the back here. So did you say that you had an idea of which eye felt stronger when you're reading at a distance? Okay, so we'll start with the weaker one. We'll be putting an occluder on that side, on the stronger side. Alright, do you have any questions? Okay, sometimes this can be a little tedious, but I just prefer it because we can really take our time, get the exact sort of small measurements that we need, and you'll be able to wear these and look around the room. Sometimes it's a little bit better than one of those big machines that you're used to seeing. Yeah, right. Okay, awesome. So let's get these on you. Alright, so your glasses are off and your contacts are out. So this should be your base vision. We are going to be covering your other eye, and that's gonna go right in here. it's just the eye that you've been having trouble with. There we go. Okay, so go ahead and take a look at the eye chart. And can you let me know what is the smallest line you can read? Okay, no problem. You can give a guess. Okay, alright. So the first one I want to try, I'm just gonna go up quite slowly. But this should be a bit of... Okay, ready? So this is 1 or 2. Which one's better? 1 or 2? 2? Okay, and what can you see? What line? Can you read that for me? Very good. Okay. So now we have 1 or 2. 1 or 2. 2. Okay, I'm gonna go ahead and pop this one in. Can you read line 4 for me? How about 5? Okay. Okay. One or 2. 1 or 2. Okay. Let's go ahead and put that one in. And can you read line 5? How about 6? Okay, but it's still a little blurry. Okay. One or 2? 2. Okay. Okay. It looks crisper, sharper. Okay. All right. Can you read line 6? Still a little bit. Okay. 1 or 2. Does that make it any better? 1 or 2. Okay. much better. Very good. All right. Can you read line 6? How about 7? Very good. Yeah, you can read 8 a little bit. Is that a little bit blurry? Okay, would you say 1 or 2? 1 or 2? Okay. Let's go ahead and try this here. Is that clearer? Can you read line 8 for me backwards? Okay. Can you read any of line 9? Good. Okay. Now if I close your eyes here, I'm going to take this. So this was 1, and this is 2. 1 and 2. 1 and 2. Okay. So this lens is what we're working with. Can you tell me, is there a difference 1 or 2? 1 or 2? Anything crisper, sharper, more blurry? Which one do you prefer, 1 or 2? Okay. One or 2? 1 or 2? Or are they the same? Okay. Three or 4? Or are they about the same? 3 or 4? Okay. Perfect. Alright. So for that, just go ahead. And if we switch the occluder, I'm going to go ahead and put this in front of this eye, and we'll take a look at your other eye. Alright, now with your left eye covered and your right eye, reading the chart, what's the smallest line you think you can read? 8? Okay. Start here. Good. Now if I do this, do you prefer 1 or 2? 1 or 2? Okay. A small improvement, yeah. Okay, great. Let me pop that in. Great. Perfect. Now, if I do this, is it better or worse? Do the letters appear smaller, blurrier? Okay. Great. Perfect. Okay. So we can actually take these off. Alright, so I have a bit of a suspicion that is proving to be correct, especially with the complaints that you came in with today. Your eyes certainly do not have equal vision. It's something called anisometropia. It just means that the prescription in your eyes are different. In your case, they're pretty vastly different. But if one of your eyes is having a hard time seeing at distance, the other is having trouble seeing up close, yeah, that's going to be tough for you to be able to focus when we're using both of our eyes together. We should be using both of them to be looking at things. So that would explain the headaches. If we fix this, those headaches should clear up, which is the plus side here. I'll be able to adjust your glasses for you, but I definitely would recommend contacts in this case. It's going to be a lot more comfortable for you, for your eyes. If you're interested in refractive surgery, corrective surgery, I can certainly refer you and give you some information on that as well. Absolutely. But what I would like to do is take a look at something really quickly. It's this little test here, and this is called the Brock string. And I just want to hold this string right under your nose. I'm going to hold it out away from you. Now what I would like you to do is focus your eye on the red ball. Good. Can you focus your eye on the yellow? And can you try to focus on the green? Bit tougher. Okay. Can you go back to the yellow? And then can you focus on the red? Good. Okay. Okay. Interesting. And if I were to change the distance a little here and add in the blue, I'm going to hold it a bit out to the side here. Can you focus on the red ball? Now the blue. Back to the red. Try the yellow. Try the green. Back to yellow. And red. Okay, good. Yep, this can be used for vision therapy. Once we get your prescription correct, I can check and see if you're having any trouble with that. But it's a really good exercise to help your eyes work together. I just kind of wanted to see where you were at. I was watching your eyes as you changed, but it's supposed to look like 2 X's, but the color ball that you're focusing on should only be 1, and you should be able to see 2 and 2 of the others. Yeah, it's a neat little test. Now for this one, I would just like for you to go ahead and cover your right eye. Can you tell me what color this is? Red? Good. And On a scale of 0 to 100%, how red is this cap? 100% red? Okay. Now I'm going to go ahead and cover your other eye. Is this the same intensity of red? On a scale of 1 to 100, is this 100% red as well? Okay, so there's no difference between your eyes in the intensity of the color. Good, okay. Perfect. Next, I just want you to take a look at this grid here. And it's going to be a little bit tough because you are having trouble with your close vision. But let me know what a comfortable distance is for you. Is that good? Alright, go ahead and cover one of your eyes. And just look right at the dot in the center. Right at the dot. Okay, now while you're looking at that dot, the grid surrounding it, but you have to keep focused on the dot in the center. Is there anything cloudy, wavy, weird, dark? Okay. Alright. I'm going to go ahead and cover your other eye. Go ahead and look at the dot in the center. Is there anything cloudy, wavy, anything different than the other eye? Okay. Very good. Very, very good. Now I would like to get a little bit closer and see what we're working with in terms of your close-up vision, what you're able to read, and this is the eye that's having trouble. Okay. So I'm going to go ahead and take this little pocket screener here, and we are going to cover one of your eyes. We'll start with the one that you think is not having too much trouble. When I hold this close, what line is the smallest line you can read from? Very good. Alright, so if I were to point this out, my pen, can you read this for me? Good. And what way is the E pointing? How about this one? This one? Great. Now is this an X or an O? X or O? X or O? Great. The line underneath. You can even give that one a little bit of a read. Well done. Okay. Can you just tell me if this is an X or O? X or O? X or O? Okay. Perfect. So really no trouble reading close up with that eye. If we were to uncover this one and cover it here and read close up. Alright, so if I were to hold this at the same distance, can you read any of these numbers for me? Okay, can you give it a guess? Alright, what if I did this? Is this better? Or worse? Better? Worse? Better? Okay. If I hold that there, is there a line you can read? Okay. What if I were to do this? Is this better? Yes? Okay. Now what's the smallest line you can read? So if we uncover both of your eyes here, I'm going to put this small chart in front of you again. Can you read this line here? Good. So what I'm going to do is put these flippers in front of your eye, and you let me know when this line is back in focus again. These kind of X's and O's right here. Ready? There. Okay. There. Good. There. Good. There. Good. 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 Wonderful. Alright. So I'm going to take a look a little bit closer. And I want to take a peek at the eye that's giving you trouble. So I want you to stay focused on the top of my light here. Okay? I'm going to get a little closer here. And I just want you to stay focused right here at the top of my light. Ready? Good. Okay. 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 Good. Now I want to take a look at the back of your eyes now. I think now that we have the prescription that we're going to be moving forward with, so we will be dilating your eyes just with some drops, and it'll take just a few minutes. I'll dim the lights and we'll be able to look. So it's just these little drops, and go ahead and tilt your head back. There we go. I'm going to go ahead and dim the lights, and we'll wait just a moment here. Okay, it's been a few minutes, so your eyes should be nice and dilated. I'm going to be getting a bit close to your eye. I'm going to put my hand right on your shoulder, and I'm going to take a look. You can just keep looking ahead. Good. Perfect. And if you need to take a break, you just let me know. Perfect. Good. Okay. Now the other eye. Good. Perfect. Good. All right. Everything looks great. I'm going to shine one more light in your eye. I'm sure you're excited. You can look over my shoulder. You do not have to look right into the light here, but I just need to measure that. Good. Good. Perfect. So, I'm not going to turn the lights on because your vision is most likely very sensitive to light at the moment. What we're going to do is get you set up with a contact appointment, and this is going to accommodate your different prescriptions in your eyes. I think the best way we can. We'll do glasses as well, but I'm anticipating that you will prefer wearing contacts during the day. Should help a lot with your headaches and, of course, being able to see a bit better. Alright, so let me get checked out here. Okay. So I'll get you scheduled for that. And you said you did have a way home that isn't driving yourself, correct? Good. We always double check that before dilating the eyes because it can be a little bit dangerous to drive when your eyes are so sensitive to light. But we can give you a complimentary pair of sunglasses on the way out. And we can also give you some trial lenses. Since you wore lenses before, I won't have to have you sit down and do the whole how to put in lenses, which is nice. But we can give you the week's worth of contacts. You try them out this week. Let me know how they're feeling at our appointment the following week. Does that sound good? You're so welcome. I'm really glad that we were able to make some good adjustments today. It was so nice to meet you, and looking forward to our next appointment. Alright, thank you so much for coming in. I will help you to the lobby. Okay. Now, what nurse was that? Is she new? Okay, because I have never seen her around here before. Well, I thought she was working with you. Okay. Alright, well, just keep an eye out. Just taking a little nap. Everything should be okay. But the blood work did come back. Okay. I'm gonna take a look at that. Your analysis. And now it's looking very, very much like appendicitis, just like we thought. Well, no. I think doing the ultrasound here, the CT scan, it's pretty backed up today too, isn't it? All the more reason. Okay, well, I have the ultrasound set up in here, but we should get prepped for surgery. Yeah. We're gonna just take a look at that. Alright. Okay. Hey there. I'm Dr. Gibi. How are you feeling? You might have been a little dizzy, a little out of it. You're more clear-headed now? Okay, good. Alright, well then we can take that mask off of you. How is your pain level? Scale of 1 to 10. 1 being no pain at all, 10 being the most excruciating pain you've ever felt. Okay, so we're doing a little bit better? Fantastic. All right. I'm gonna move in here for a second. I'm just gonna ask you some questions, okay? All right. Is this your first time in this hospital? Yeah. Okay. New patient. All right. Did you grow up in this area? Okay. No, I went to school in Chicago. Yeah? Oh, that's awesome. No, I wanted to go back. Absolutely. Okay. So I'm just pulling up your blood work and your urinalysis results, okay? Those are the tests that we had you do when you came in and you got your vitals. Okay. How was your nurse? The one with blue hair. Okay, you know, I might have some questions about that later. You know, okay. All right. So what I wanted to do was just go over the symptoms that you had reported. We did get some pain medication in you, which you had a little bit of a woozy reaction to, yeah? Okay. We'll have noted that in the dosage in your chart. So this pain that you came in with, this was abdominal pain. Okay, and how long ago did this pain start? When it did start, was it a little bit more localized? Has the pain moved or changed at all in the last day or so? Okay. So if you had to give it like an area of your abdomen, you would say it's the lower right side, yeah? Okay. Right. So that is definitely one of the biggest symptoms that we tell people to look out for with appendicitis. I know you're thinking you might have appendicitis. I think that's a very good guess. We're going to get a couple of more clues from the results of your blood work and your analysis. So I'm just taking a look at that here. And it looks like with your blood work, your white blood cells count, it's much higher than normal. That would indicate to me infection, inflammation. Again, that's lining up with appendicitis. Now with your urinalysis, I'm not seeing anything that would indicate to me that you have kidney stones or a UTI or anything like that. Sometimes those things can very much mimic appendicitis, which is why we check for those. So the fact that those are not showing up, again, makes me think we're headed in the right direction. And the thing with appendicitis, it's so important that you come in right away. So I am glad. I know it looks here, you spent the night, woke up in the morning, and it still was not great. Okay, right. Yeah, well, it was the perfect time to come in. We really don't want to wait for the appendix to have a chance to rupture or perforate or anything like that. It turns it into a whole different scenario. So what we're going to do is essentially confirm that this is what you have. With appendicitis, I don't know who's talked to you yet. This is considered an emergency surgery simply because we do want to get your appendix out before it does have a chance to rupture. So that's where the sense of urgency really comes from. So you'll be looking at surgery today, absolutely. So I just wanted to let you know that before I start the examination, just so you can start thinking about it. If you have any questions or concerns, people you need to contact, we'll be able to help you with that, okay? Good. All right. So let's move back to your symptoms here. Your fever, you took that this morning at home. And once again, when you got here, I'm going to want to take that one more time just to make sure that it's not going up, okay? And the pain in your abdomen, it has lessened since you received your pain medication. That's really good. Yeah, essentially we just want to make sure that during the process of diagnosing you, you aren't sitting here writhing in pain, okay? Very old school way of thinking is that I wouldn't be able to diagnose it if we gave you pain management. So, no, not here. I'm glad you're feeling better. It makes my job easier, makes your life much better. Win-win. Okay? So please let me know if you're feeling major pain or discomfort, if you're having problems focusing on what I'm saying or things like that. Just, you can absolutely speak up and I'll be checking in. Okay. So the pain in your abdomen, would it get worse or better if you were to stand up and walk around? Mm-hmm. And what about if you were to cough? It gets worse, right? Okay. Mm-hmm. How about the nausea and vomiting? Have you been able to eat anything? Okay. Well, that's actually good, especially if surgery is probable. We need to make sure that you didn't eat anything in quite a while, so you don't think you've had anything for 12 hours? Even longer? Okay. All right, well, loss of appetite absolutely is a very common symptom. Again, we want to make sure that you don't eat or drink anything until we get this figured out. Okay. All right, how about any bloating, constipation, diarrhea, anything with like your GI? Okay, and did that start before or after the nausea? Okay. All right. Has anything made your pain more severe? Mm-hmm. And then has anything made it better at all? Feel best when you're lying down. Okay. What about if you were to sit up? I'll be alright? Okay. Okay, that sounds good. I just want to double check here. Do you have any allergies to medication in particular? Okay, previous surgeries. That should have all been taken down, but I just... Right, alright. Thank you. Okay. So, what I want to do is take your temperature. I also am going to do a very brief abdominal exam. I would just be kind of pressing down on your stomach a little. Nothing crazy. If any of that is too uncomfortable, you'll be able to let me know. And then we will set up for the ultrasound. So the reason that I wanted to get an ultrasound is to confirm that is appendicitis. I should be able to find your appendix and determine just some key things that we'll want to know before going into surgery. Confirm that there's no perforations, confirm that it has not ruptured, things like that. It is something I can do here in this room. It's going to be a little bit more affordable. The CT scan would take a bit longer to get you in there. So what I'm going to do is use the ultrasound, and hopefully that'll give us exactly what we need. But if it doesn't, we do have more options. It's just what I would like to start with. Does that sound good? Ultrasound is painless. It uses a probe-like camera. It's going to go on the outside of your abdomen, and I will be pressing down on it on your stomach, so that can be a little bit uncomfortable at times, but you'll be able to take breaks if you need to. Okay. All right. Let me take your temperature, and I'm gonna push this aside. First, very briefly, I'm just gonna have you look at my nose, okay? Keep looking at my nose. Just want to make sure you're back to reliable responsiveness. Okay. I'm gonna hold my finger right over this light. Can you follow this for me with your eyes? Good. Good. Move a little bit closer. Farther away. Here. And here. Okay. Perfect. Thank you. I'm going to have you put this under your tongue. And we'll just hold there for a moment. Perfect. Okay. You do still have a slight fever, but it's not going up. So I am going going to go ahead and proceed with the abdominal examination. Are you too cold or anything like that? I'm going to pull the covers just down to expose the bottom right side of your abdomen like that. Is that okay? Okay. And I'm going to place my hands on top of your stomach. It's going to feel like this. Good. All right. So right now I'm just going to move my hands from side to side, starting near the top of your abdomen. And I want you to let me know where there's more pain. Right there? Right there. Okay. And then if I keep moving to the left side, not so much. Okay. So I'm going to do some percussions, which just means I'm going to put my fingers there and give a little tap. It's going to help me feel underneath. Is that good? Okay. If anything is particularly sore, let me know. Okay. Right there. Mm-hmm. Okay. Right. Okay. So, because I don't think that your appendix has ruptured yet, which we are going to confirm, what I can see happening is a laparoscopic surgery. So the laparoscopic surgery is a little bit more new than maybe you've heard about people having appendicitis in the past. Maybe read Madeline as a child. I did. But this is a way of doing surgery in which you'll have much smaller incisions. People's recovery time is much shorter, so when we can do those, I definitely prefer to. We would be making one incision near your belly button, and that is actually where a very, very tiny camera goes through and allows us to see. And then 2 other very tiny incisions would be made, and those are what our tools would have access to be able to remove your appendix and stop all this nonsense. So some people, like, you don't have any sort of dense scar tissue in the area. Fantastic. And so that will be our first line of defense, essentially. But there are other options as well. Go ahead and put these blankets back on you here. Is your pain level still the same? Do you have any questions so far? Okay. Alright, well let me take a listen to your abdomen with stethoscope as well. You just hold here. Okay. Mm-hmm. Okay. Good. Okay. I would like to see the images from the ultrasound. That's going to determine the most, I think. And recovery would be fairly fast. I typically would tell my patients if they go for laparoscopic appendicitis, about 3 weeks of not doing any heavy lifting, but you'll be able to go home very soon, usually 1 to 2 days. Yep, so if I get the ultrasound set up here, we'll be able to take a look. So the appendix is actually about a finger-shaped size organ. You don't need it. You can function without it. And I just want to get you turned. So you're going to come a little bit this way. I'm going to push your bed up slightly. Ready? Okay. And then we're going to turn you this way. Very good. So this is the ultrasound machine. I went ahead and turned it on, so that humming that you hear, it's just coming from the machine. Have you ever had an ultrasound before? Yeah, so they're very common. You probably have heard about them. Usually you associate them with pregnancy and things like that, but you can actually use it to see a lot more than just that. So what I'm going to do is set up this probe, and I'll be putting this probe on your skin. I'm kind of pressing down on your abdomen. It might take me a little bit to find it because the appendix is notoriously hard to find on the ultrasound. Sometimes people prefer CT scan, even MRI, but again, this is going to be a little bit faster. If this doesn't work, we can explore alternative routes, but I think we almost definitely have our answer. So I'll be looking at the screen right there. This is what's going to go onto your abdomen. This is just a disposable cover. And then we have the ultrasound gel as well. If you've ever had aloe put on after a sunburn, very similar. Again, can be a little bit cold. So this will just help the probe here kind of just glide across your abdomen so that there's no pulling or anything like that. So we're just going to pull the blankets down. Are you feeling okay? Okay, good. If any of this is uncomfortable, again, let me know. I will be pressing down kind of hard at points to get the correct image. There'll be some twisting and turning, just trying to get the image that I need to see. Again, sometimes it can be quite hard to locate the appendix. It's a little bit different on everybody. I'm going to put a little bit on your skin here. Okay. Ready? Just going to feel like this. Okay. Good. And I just want to get this right over here where I can see it. Perfect. Perfect. You doing okay? Good, good. Okay. Okay. You know, most of the time, appendix, very hard to locate. Yours is not difficult to locate. There it is. And yeah. I do not see a perforation. It does seem to be intact, but definitely inflamed. This is appendicitis, just like we thought. You thought. We all knew. So, I just need to get a few pictures here. You're still doing alright? Okay, good. There we go. Okay. Right. Right. So, with that very much confirmed, we are going to prepare to send you down to surgery. So, if there's anyone that we can contact, we absolutely can. The surgery typically is 30 minutes to an hour. Very routine surgery. I would be happy to talk through any concerns that you might have. I know that coming into the emergency room when you were feeling just a little not too good yesterday, and now all of a sudden you're getting surgery, it can feel very overwhelming. So we do have time to talk through things. Right, so we can't really predict if or when it would rupture, but that can be a lot more serious. So it would absolutely be in your best interest to do that surgery now. Some people do treat their appendicitis with antibiotics. We have given you some antibiotics pre-surgery to start treating that. Sometimes people can treat it right fully with antibiotics and no surgery. Almost all of them will come back with appendicitis again within a year. They'll almost always likely get their appendix removed eventually. So since we caught this, I would definitely say that we could do it now. Your recovery time would be, I would say, to expect to stay 1 to 2 days here. For somebody like you, I looked at your chart and your history. I would expect one at most. But after the surgery, I'll see you again. We'll be able to look over and make sure that everything's okay before we send you home. But I know a lot of people don't want to stay here. They want to get out as fast as they can. Hopefully we can make you as comfortable as possible while you're here. The anesthesiologist is actually on their way. And you'll be going under general anesthesia. That just means that it will essentially be like you're asleep. You won't remember anything. You will not feel any pain at all. And you'll wake up in your recovery room, which is very nice. So what we want to do is I'll call in some help and we will take your bed. We're going to roll you down to surgery, and there you will be able to talk to the anesthesiologist. We'll be able to meet the surgical team. Well, I'm really glad that you came in when you did. I hope that this hasn't been too rough an experience for you. I know. All right. So what I'm going to do is go get some help, and we'll just start bringing you down, okay? Do you have any other questions? No problem. Absolutely. Okay. All right. I'll be right back. You stay put and everything will be just fine. We'd like to direct your attention to the safety demonstration as we prepare for takeoff. Please allow us a few minutes of your attention. You may follow along by locating the safety card in the back pocket of the seat in front of you. At this time, all portable electronic devices must be set to airplane mode until we reach our cruising altitude. All larger electronic devices, including laptops and tablets, must be stored under the seat in front of you until after takeoff. All baggage must be secured underneath the seat or in the overhead compartments. We also ask that your seats and tray tables are in the upright position for takeoff. We remind you that this is a non-smoking flight, including electronic cigarettes. Tampering with, disabling, or destroying the smoke detectors in the lavatories may result in a fine. U.S. law requires all to comply with lighted and posted signs and crew member instructions. This aircraft is equipped with several emergency exits and are clearly marked. Please take the time to locate the one closest to you. Please remember, this may be behind you. In the unlikely event of an evacuation, floor-level lighting will guide you toward the exit. Doors can be opened by moving the handle in the direction of the arrow. Each door is equipped with an inflatable slide, which may also be detached and used as a life raft. Please remember to follow all flight attendants' instructions in the event of an evacuation. When the seatbelt sign illuminates, you must have your seatbelt fastened. Insert the metal end into the buckle and tighten by pulling on the loose end of the strap. To release your seatbelt, lift the upper portion of the buckle. We suggest that you keep your seatbelt fastened throughout the flight, as we may experience unexpected turbulence at any time. If you intend to sleep during the flight, please be sure that your seatbelt is visible to flight crew so you will not be disturbed. Oxygen and air pressure are always being monitored. In the event that oxygen is needed, an oxygen mask will appear in front of you. To start the flow of oxygen, pull the mask toward you to extend the tubing. Place it firmly over your nose and mouth, secure the elastic band behind your head, and breathe normally. Although the bag may not inflate, oxygen is flowing to the mask. If you are traveling with a child or someone who requires assistance, be sure to secure your mask first before assisting others. Keep your mask on until a uniformed crew member advises you to remove it. If you are wearing a mask during the event of cabin decompression, be sure to remove your mask first before putting on your oxygen mask. A life vest is located in a pouch under your seat or between the armrests in the unlikely event of a water evacuation. When instructed to do so, open the plastic pouch and remove the vest. Slip it over your head. Pass the straps around your waist and adjust at the front. To inflate the vest, pull firmly on the red cord only after you have left the aircraft. The vest may also be inflated by blowing into the red tube. Lights will automatically illuminate in the water. Additionally, your seat cushion may be used as a flotation device. Pull the cushion from your seat, slip your arms into the straps, and hug the cushion to your chest. The crew will now be coming around to do a final cabin check. After takeoff, we will be back with more information. We are here to make your flight safe and comfortable. Thank you for choosing Gibi Airlines.
Flight attendants, please prepare for takeoff.
Hello. I hope that you had a comfortable takeoff. Since this is an overnight flight, I'm just going through the cabin and making sure that everybody has what they need. Were you planning on sleeping through the night? Okay, perfect. So what I'm going to do is actually just enable sleep mode on your screen here. And that'll show us that you are sleeping, so we won't come and disturb you for anything. However, if there is anything that you need during the flight, we are just a button press away. Oh, no, I won't be sleeping. I already got a full night's rest. That's very kind of you to ask. I actually quite enjoy the night flights. Yeah, the lighting in the cabin is very calming, and this is actually a very quiet flight in general. Yeah, it should be a good one. So how can I make your flight a little bit more comfortable? Okay, well, may I offer you a beverage? We have a wide variety of different drinks. We can do sodas, we have juices, cocktails, wines. We also have sparkling water, bottled water, as well as a very, very nice tea and coffee selection. Some sparkling water and tea. That's a great choice. Do you have a flavor preference for that sparkling water? I know we have blackberry. Would you like to try that? That one's my favorite. Okay, great. We'll do the blackberry sparkling water, and I will show you our tea collection. Okay, perfect. All right. Do you travel often? Sometimes these longer flights, they're a little bit relaxing, you know? You just get to kind of unplug for a little bit. There's nothing else you can do but sit back and relax. This is the blackberry bubbly. Is this good to you? Okay, perfect. Would you like ice? I'll just do like a cup with some ice in it. Sounds good. There we go. So I'm going to go ahead and place this on your tray table. Okay, so we're just going to put that down here. There you go. Perfect. And would you like me to leave the can with you? Sure. Absolutely, I can do that. And if you need more ice, you can just let me know. No problem. Now, for our tea selection. We have a few different flavors. Do you know what you're looking for, or I can go over them with you? Absolutely. So we have the calming tea. This one is non-caffeinated, and it has things like chamomile, licorice root, hibiscus, cardamom. Very good one for the night flight, of course. We have one of my favorites, the honey lavender stress relief. Of course, this one has chamomile as well, but it also has the lemon balm leaf, lemongrass, spearmint, peppermint, lavender flower, and a little bit of the organic honey flavor. But if you would like extra honey, I can just get that for you as well if you want to just add that in. This one's non-caffeinated as well. This mango ginger, caffeine free. This one has ginger root, cinnamon bark, mango flavor, licorice root. This one's pretty good. I recommend this to people who maybe get a little air sick. The ginger can help a lot with that. Next we have the caffeine-free honey chai turmeric vitality. This is more of a spicy blend. It has the cinnamon bark, turmeric, some ginger as well, cardamom, honey flavored, clove, and black pepper. Yeah, it's a good one. Now this one does have caffeine in it, so maybe you would wait for the morning. This was the vanilla spice. Perfect energy. Yeah, maybe not for now. Absolutely. And finally, the blackberry apple cider digestive awakening tea. This one's awesome. Very, very good. Especially sometimes when we travel, our body's clocks can get a little out of whack, like having this one on board. Did any of these speak to you? Perfect. We can do that. Fantastic. So I'm going to go ahead and get the water. And also, would you be interested in a nice hot towel? Okay, I'll get that as well. There we go. And this should steep for probably, I would give it about 5 minutes. Do you need any extra cream, sugar, honey, lemon? Okay, no problem. I'm gonna go ahead and put this right next to your sparkling water. Okay. And let me go grab that hot towel for you. Here we are. One of my favorite parts of any flight. Now be careful because this is quite hot. Just gonna shake it out a little bit, get the steam out. Okay, here you go. And you can use that to wipe your hands, your face, whatever you'd like. And I can collect that for you in a moment because I just wanted to ask if you had gone over the breakfast menu yet. Not yet? Okay. We will be serving breakfast about 2 hours before we land. So you have a little bit of time until we get to that. So we do have a snack basket available at all times if you need anything to eat. We don't want you to go hungry waiting for breakfast, even if you're planning on sleeping through the night. But would you be interested in the snack basket? And perhaps I can go over the breakfast menu with you. We can make your selection now. And then when we come around to the cabin to wake everyone up for the morning and serve the food, I'll have your selection already. Okay, perfect. Perfect. All right. So our menu for breakfast is quite nice. Let me just grab a pen here. Okay. Ooh, we have some great options. The first one would be the sweet stuffed French toast, and that comes with amber maple syrup and optional powdered sugar, strawberries, and fresh whipped cream. The next option would be the poached egg. Now this is served on a caramelized onion tart. It's so good. And that comes with spinach. It's kind of cooked and seasoned on the side, and a really nice mustard hollandaise sauce over top. And then the third option would be the biscuits and gravy, and that is served with bacon and breakfast sausage and some seasoned scrambled eggs. Do any of those sound good to you? Excellent choice. Okay, I'll have you marked down for that. Do you have any dietary restrictions or allergies that I should know about? We are very safe and robust with our allergy policy. We're very careful of cross-contamination, and we know all of the ingredients that is in the food. Yes, more airlines really should be like us. It's true. We're the only airline that does that. But you would think, food allergies on a plane should be very serious and a big deal, So, we got you. All right, so I'll go ahead and note that down. And now that we have your menu choice, I'm sure you're hungry. So let me go grab that snack basket for you. Okay, so here is what we have for snacks. I'll let you take a look. We have this is the Made Good Vanilla Crispy Square. We have the Strawberry Chia Fruit Bars. Chocolates, if you like some chocolates, there's Godiva and Dove. A little bit of candy, maybe if you need a little sweet something before you go to bed. We have almonds and sunflower kernels. Oh, these are lovely. The soft chocolatey chip cookies, really good. Also a few trail mixes and some other bars. One of those? Perfect. Okay. And if you'd like anything else, just let me know. We actually keep it at the front of the cabin. You can just come up and get it yourself, or you can call me over and I'll show you what we have. Okay, great. So, did you locate your grooming kit? So that would be right here in this little door there. You have a bottle of water included in there, just in case you need some extra. And then the grooming kit. This comes with some really nice things. The first of which would be your cozy sleeping socks. Would you like me to take those out? Yeah, so we have your toothbrush and a little toothpaste kit, but we actually have more toothpaste later. And then you also have an exclusive skincare set. And that comes with these nice little travel size creams and lip balms. All the ingredients are listed on the back, just in case. And of course, the socks. Oh, and a little mint included in there as well. socks. Most people just wear these around the cabin. Totally fine to do that. You don't have to put your entire shoes back on. These are great. I would hesitate to walk around barefoot a little bit. Some people do. I just, So you have that in there. And in the actual kit itself, there are 2 deodorant options. One is an antiperspirant, and the other is the native coconut vanilla deodorant, just for a little bit of a freshening up, whichever one you prefer. There's also the Neutrogena Hydro Boost face moisturizer, which is very useful. When you travel a lot via the air, your skin can get very, very dry. We also include eye drops. Again, for the dryness, sometimes it can just be a bit much up here. A vitamin C package. You could dissolve this in your water bottle. And if you need an extra water bottle, I can bring you one of those as well. And a small bottle of Listerine, of course. Now, in the other pack, you would have hand sanitizer. If you need that. You have a little mini Aquaphor. This can be used as lip balm. It's also good for any sort of dry skin, hands, whatnot. Then there is the bigger size toothpaste. The toothbrushes come with them, but we also offer these, which are a bit more robust. And then a couple of tiny additions here, so you can see little wet wipes. These are great for your hands or even your phone if you want to disinfect that at all. A couple of those in there. A single pack of Purell and a tiny Advil. And we do have a first aid kit if you need anything else. Okay. Perfect. All right, so do you want me to go over your in-seat buttons as well? Right, so when you're ready to lay down and go to sleep, right over here, these buttons will recline the seat, or you can press this and that will simply kind of lift up your legs there. And then right behind where that kit was, you have a pair of over-ear noise-canceling headphones. You can use this to watch anything on the screen. Exactly. And oh yeah, we offer a ton of free movies, TV shows. Since this is the night flight, you might be interested in the kind of calming section. Yeah, this one right here. It has some soundscapes, meditations, ASMR. There's even white noise, which is sometimes funny because we're already on a plane. We have the white noise. But maybe you need an extra layer. That's all in there. You can use those headphones for that. Yep, the remote is built in on the side here. And there's free Wi-Fi included. If you need to do any work or you have any messaging or emailing to get done. Maybe not at this time of night, but you never know. Some people are just night owls. They'll work right through this flight. And I'm not quite sure what they do in the morning, but... So if you're ready, we do offer full Tempur-Pedic pillows. It gives a lot of support on the neck. I can bring you one of those if you're ready for sleep now. Great, no problem. And let me go ahead and take your towel as well. All done with that. I'll be right back. All right. So first up, of course, we have your sleep mask, if you would like. There you are. May I unfold your blanket for you? Perfect. I'll go ahead and give you your pillow. Yep, so it's a nice, thick, square, cube-shaped, and this will help with a lot of the kind of neck cramps that people get when they're traveling. Since these seats recline all the way, it's great to have these. Okay, perfect. Give you a little pillow cube here. And then I'll unfold your blanket. Okay. All right, here you are. Wonderful. Okay, there you are. Now, would you be interested in a hydrating sleep mist? Oh, yes, yes. So, we can kind of spray this on your blanket. It has a very light aromatherapy. It has to be very light because in the cabin here. And it also hydrates. Okay, perfect. All right, so you can go ahead and close your eyes. Close your eyes. There you are. All right. You are ready for a good night's sleep. Absolutely. Now, if there's anything else at all, of course, I can get you. You just let me know. Otherwise, when you wake up, we'll be pretty close to landing. Absolutely. I'm here to make your flight safe and comfortable, so don't hesitate to hit the call button, but otherwise, sweet dreams. Hi there, I'm your travel agent. Are you looking to leave your boring, incredibly tedious, yet somehow overwhelmingly stressful life for something more fun, relaxing, new? Perfect, you are in the right place. Go ahead and sit down. I will plan all of it for you so that all you have to do is relax on your adventure. So tell me about yourself. Do you like history? Do you like good food? I'm sending you to Rome. You get to look all academic and cultured for your social media friends while absolutely gorging yourself on Italian food, cuisine, and gelato nightly. Sound good? All right, perfect. All right, tickets booked. Now, okay, so you really like history, right? So you want to go to the Colosseum? You want to go to the Colosseum and you want to stay in the Colosseum. I can arrange that. It's a little bit dusty, but it's an experience you will never forget. You want to see a church? Oh, well, I have very good news for you then. Very good news. And in terms of transportation, we can arrange a private jet and car. You would prefer a razor scooter. Okay, well, perfect. No shame in that. No problem. Very green of you, actually. Now, for your tour guide, we can get for you the Ghost of Emperor Nero. Yes, since he died in shame, he has been dabbling in the tourist business. You'll get along fine. He's matured a lot. All right, and now all I need is your incredibly personal information. That will be your passport number. I will need your address, name, blood type, a strand of your hair, allergies, just the normal. Thank you. And you're booked. All right, it's a one-way ticket, so you can just let me know when you're ready to, return again to your boring life. Have a good trip. Bon voyage. Why, hello there. You look like you're ready to get your insecurities absolutely scrutinized and drawn in a comical fashion by an artist. Sit. I am so ready to do your caricature. Yes, indeed. So, did you wear that today on purpose? It's hilarious. I love it. I like the hat in particular. So go ahead and turn to the side. Let me see those cheekbones. Oh, that's a big noggin. Okay, very cool. Now, do you usually, look like this? Yeah? Okay, fantastic. Well, I love to see it. And what do you do in your free time? Oh, really? I'm surprised. Okay, well, just a little more detail here, a little more this, a little more that. Freckles, I believe. Go ahead and smile for me. Turn your head to the other side. Okay, so if you are ready to see it, payment first. Thank you. And Why aren't you smiling? You don't like it? What do you mean it looks nothing like you? My parents did not pay for 4 years of art school for this slander. You will take this photo and you will put it up in your home and you will frame it because this is art. Hey there, welcome to my private studio. Why, yes, it does double as my bedroom. Thank you so much for noticing. So, you're looking to get a stick and poke tattoo? Oh, thank you for coming in. How did you find out about me? Your friend Craig got tattooed by me at a party. Oh my god, I don't remember that at all. I must have been. Alright, well, anyway. So, you're looking for something what? Unique, different, a little, something that's gonna make you stand out. Oh, what about zodiac sign? Oh, that'd be so cute. That'd be super, super cute. Yeah. No, I did all of these myself. I'm completely self-taught. I know. No, thank you so much. That's crazy. Okay, so I'm just gonna go ahead and put some gloves on. Perfect. And where do you want this again? I think the side of your neck will be really subtle. Kind of cute. Okay, cool. Alright, so first we gotta, get you nice and sanitized. Sanitize. Just like that. Okay. Yeah. I love doodling on my friends and myself at school, and then I was like, you know what? What if we made this permanent? That'd be so awesome. So, here I am. Okay. You can Venmo me, right? Yeah. It's gonna be $9. Yeah. Raise the price a little bit, Okay, so just gotta sanitize a little bit, plus this stuff smells good, so it'll be perfect. Now, what needle do you want? Are you going for more of like the sewing needle, or do you want a pin? Good choice. Okay, so I'm just gonna take this, and you can get some stuff off Amazon, but I kind of ran out, and this is fine, old-fashioned way. Just get a little bit of tape. Just get that off. Febreze makes everything a little slippery there. Okay, just tape that on, and then once this tape is ready to go, then we are pretty good. Okay, so here are the designs that I have. If you're not sold on any of them, you can do anything you want. I do customs. Okay, you can do the eye, diamond, little, something or other. Hags, fish, jellyfish, sparkles. You're super sold on the zodiac? Yeah, no worries. I totally get it. Okay, so we're just going to go ahead and start inking you up, dude. Okay. Go ahead and sit back and relax. Ooh, sorry about that. Just got a little bit of... You said Libra, right? Oh, well, it looks really cool. No, it looks really cool. Just tap. Go ahead and stick, and poke. Stick and poke. We are almost done. You are so brave. You're like barely even crying. That's awesome. It's really hardcore of you. Okay, so all done. So you gotta go ahead and make sure that you give it some sun so that it can really set into your skin like that. Really bake it in there. Don't worry about moisturize or anything. If you just do some extra exercise, build up some sweat, all that sweaty moisture, that will give you you'll be super damp and it'll be awesome. Yeah, sit, go ahead, look in the mirror, tell all your friends about me, and I hope you enjoy your new tattoo. Hello, it's your beautiful vocal coach ready to get your voice ready for your big performance. Oh my dear, your voice is so raspy and disgusting. Fear not, I went ahead and made you a little bit of tea in Mr. Moo Moo. So go ahead and drink from Mr. Moo Moo. Drink it. Let the tea and the honey coat those vocal cords of the gods. Now, go ahead and let me hear again. That's what I'm talking about. Now I need you to use your diaphragm, okay? We only use our diaphragm here. It's actually the only thing that you need to think about. So go ahead and let me feel that diaphragm. Come on. Yes, singing. It's very, very unembarrassing. Alright, so we're going to do a little bit of warm-ups here. Now, when we think of Mr. Moo Moo, what do we do first? Ma me moo moo. Ma me moo moo. Ma me moo moo. Continue. Oh, that's what I'm talking about. Alright. Mommy made me mash my M&Ms. Peter Piper picked a peck of pickled peppers. All I want is a proper cup of coffee made in a proper cup of coffee pot. Sama lama duma lama, you assuming I'm a human. What I gotta do to get it through to you? I'm superhuman. Well, we'll work on that one. Go ahead and do your lip trills. That means I want you to go. Give me the lip trill. Now try sadness. Sad lip trill. Angry lip trill. romantic lip trill, pain lip trill, fear lip trill, loathing lip trill. Oh, you've got it down pat. You've got it down pat. There's not much more I can teach you. So go ahead and breathe in this steam. Go ahead, breathe it in. Get it in your lungs. Oh, you are all warmed up and ready to go. Do not speak until your performance. Hello, welcome into the bank. What can I help you with today? You'd like to make a deposit? Okay, well, you're going to have to go ahead and fill out one of these little slips that no one ever has formally taught you how to do. But if you don't know how to do it, well, you're going to feel like a huge idiot in front of everyone. So go ahead and take that. All right, go ahead and start filling that out for me. And is there anything else that I can do for you while we are waiting on that? You need a pen? There you go. There you go. Go ahead and take that pen. Don't steal it. Don't steal my pen. Don't steal my pen. I'm going to go ahead and need your ID. Take your ID. Take your ID. Take your ID. Thank you. And then I'm going to go ahead and look up your bank account now. Interesting. Okay, you need that in all ones. All right, if you say so. If you say so. Not my job to question you about your habits. So I'm going to go ahead and count that out all in ones for you there. All right. You only want 19? You only want 19? Okay, I'll go ahead and put that one back in the bank so we can accrue some interest and you can go ahead and retire on time thanks to the bank helping you do that. Okay, so here you go. Here you go. There's your little money slip there. Go ahead and tuck that away. Walk quickly back to the car. And was there anything else I could help you with? You want what? Nickels? You want $2 in Okay. I have to say, this is absolutely the weirdest thing I've ever had to do in all my time at the bank. I don't think I have any recollection of anyone ever requesting me to give them nickels. So here you go. Pretty sure these nickels are from 1970. $2 of nickels, you little weirdo. Okay, is that it? Can I help you with anything else? All right, then get out of line because I have to get back to work and enjoy the rest of your day. You are welcome for the bank giving you something. We do something for you. Well, hey there, thanks for coming into your friendly neighborhood orthodontist to get your braces tightened. You know, I know that I've said that you're going to get your braces off any day now, but I will continue to say that for the next 6 months, so go ahead and take a seat and get comfortable. So I can offer you some very fun colors today so we can make your mouth super rainbow and shiny and awesome. So we have purple, blue, salmon, green, yellow, clear, or black. Which one would you like this time? Which one do you want? You know, you can pick any one you want. It's so awesome. Braces are fantastic. You want a little bit of all of them? Okay, you know what? You didn't have to make my job difficult. You didn't have to make my life difficult, but you chose to anyway. So I'm going to go ahead and take that out on you. All right, so go ahead and lean back in the chair. I'm not going to use gloves because, to be honest, it kind of gets in the way of my very delicate work. So no worries. I washed my hands this morning. It's fine. Okay, so I'm going to go ahead and snip, 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 snip off all the rubber bands that were on there. Snip, snip, snip those away. Okay. Alright, so how's school going? Please don't talk with my hands in your mouth. Okay, so I'm going to put these rubber bands in your mouth. Boom. Bam. Okay. Oh, yeah. Okay. World record. Fantastic. Alright, now I'm going to go ahead and get these a little tighten, okay? Let's go ahead and hold on to the chair. Okay. Yeah, that's what we're talking about. Okay. Alright. So you're going to notice a mild discomfort in the next day or 2 or 10. It's fine. Whatever. Your teeth will get used to it. Okay, so now what we want to do is also add in some rubber bands that you're going to wear always. Actually, it's not always. It's just 23 out of 24 hours of the day. So you're really fine. You get to take a little break. So we're going to have them start here and go across the teeth from here. And then the other one's going to start here and go across the teeth from here. Then we want 2 back here, 3 back here, and 1 extra one going all the way to the other side. And that's how we're going to make your teeth look nice and super shiny, straight, like this guy. Don't you want to look like this guy? Okay, that's what I thought. All right, so if you don't have any other questions, I will see you again next month. Amazing. Hey, you're the one that needed tutoring, right? Yeah, no problem. I don't mind at all. See, I get to pay $10 to do this, and I just started playing Genshin Impact, so I'm gonna need all the cash I can get. Okay, so you said you were having some issues with like, the double-digit addition and subtraction. No worries. Everybody in high school does. I totally get it. So I actually came up with a foolproof way to like do it as fast as possible. So all you have to do is add them together. So like 10 plus 15 is 35. Yeah. Oh, it's 25. Yeah, you just have to get it right, and then you just like write it really fast, and then you're done. So it's like 10 plus 15 is 25. Boom. Next one, 44 plus 36. That's like kind of like maybe like 90ish. And then 81 plus 27. That's like definitely 100. Maybe like if it's 7 plus 8, so that's like 108. Then we have 88 plus 12. That is like, go ahead, and that's 100 right there. Everybody knows that. 24 minus 16. So if you take 16 away from 24, what are you left with? What are you left with? Like if there's 24 of them, and you take 16 away, what would you be left with? Probably like around like 14 or something like that. And then 59 minus 40, that one's easy. 0 minus 9 is 9, so boom, there you have it. 5 minus 4 is 1, so 19. That was a close one. Go ahead. 99 minus 32, that's 69, dudes. 63 minus 29. You could just count on your fingers for that one if you want, but I'm pretty sure it's something close to like, I don't know, 43. So boom. Alright, 35 plus 35. All you have to do is multiply 35 times 2. Yeah, so clearly everybody knows that that's 70. Obviously, that one's an easy one because you can just multiply by 2. Like adding 35 and 35, difficult. 35 times 2, easy. Okay, 76 plus 25. It's like almost like 2 quarters. So it's like 101 Dalmatians, bro. And then 13 plus 52. It's probably like 65, something like that. 48 plus 16. That's like a little bit more than 50. Maybe not 60, but 61 maybe. 92 minus 18. You want to go ahead and give this one a stab? 80, love it, sounds right to me. 30 minus 21, that's a 9. This is like a 30, and 22. All right, so your homework is all done. See, you don't have to take long on it at all. You just submit it, boom, you get your points, you get your credit, and you're gonna ace that final exam. You're so welcome, dude. Hey, welcome to the hotel. I'm so excited to check you in today. Are you ready for your room? Okay, so like, what's your lucky number? I can give you that room number. Perfect. Okay, I'm gonna go ahead and give you your card then. Here you go. Here's your card, and if you look on the back, that's the Wi-Fi code. It's the 45-digit number. That's the Wi-Fi code. You have to put it in every single time you come in. Yeah, it's awesome, but it's free, and it's really, 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 really slow. Okay, so breakfast time. Breakfast time, we do it from 6:15 to 6:18. It's all-you-can-eat style, so go ahead and go crazy for that. With amenities, we have beds, toilets. You get a towel, and there's a shower sometimes. If there's any other amenities that you can want, you can go ahead and ask, and I'll figure it out for you. All right, checkout time is at 8 a.m. If you want a late checkout, I can give you an 8:15. I can give you an 8:15 for sure. All right, so let me just show you on the map here. If I open this up, as you can see, Millennium Park is right next to the Fairmont Hotel, which is right next to the Hyatt Regency. Okay, I know we're not in Chicago. I just thought it was interesting. Sue me. Here you go. You can keep that if you want, but if you're not going to appreciate it, I want it back. All right, so we can take your bags up for you if you want, but it's kind of lazy if you just don't do it yourself. You do want to stick our bags up for you? Okay, I'll go ahead and take that bag up for you. And for the spa, did you want to book a massage? Well, we can actually just have someone come upstairs and roll little Hot Wheels cars over your back while you're falling asleep. It is a luxury. It is a delight. Good. All right, I'll sign you up for that. And if you have any other questions, go ahead and use your hotel phone. It, sometimes works. I don't know. Have a great stay. Hi, welcome to the Apple Store. Can I interest you in our latest technology? Oh, perfect. Okay, so this is the Honey Crisper. It's just like Honey Crisp, except for it's crisper. We also have the Honeyer Crisp, which is just like the Honey Crisp, but with more honey. Okay, this is our most popular and our newest model. All right, then we have the Red Delicious. The Red Delicious. Now, propaganda will have you believe that this isn't just mush. Okay, beautiful, beautiful. Next up, we have the Fuji, a tried and true favorite, very unproblematic. Just a Fuji apple. This one's pretty plump. This one looks pretty juicy, ready for you to bite into. Now, of course, we do have the Granny Smith apple, but if you want to get this one, I'm going to have to see your license. You understand. The Granny Smith is only for the brave and, the courageous. Okay, and then finally we have the golden delicious. The golden delicious. Now this one is often forgotten about, and to be honest, it's just quite sad, really. But you know, we love you anyway. So, what do you think? Which one would you like to purchase? What does your phone have anything to do with any of my apples at all? Get out of my store. Whew, I am all done filming. Thank God all I do is whisper for a living, because if I had to do a real job, I do not know what I would do. Okay, time to upload the footage. Luckily, all I have to do is just ask my camera to do it. Hey camera, can you please upload the footage to Vest? Upload complete. Oh my gosh, thank you so much. That was so easy. Oh, they're gonna love this one.
Just another easy day of pretending to edit videos while I really just look at a bunch of vests.
Download complete.
Oh, download. Well, I guess another GB video is ready. Let's go see if we can find it. Alright, let's see what we've got here. Pop open the old GB folder. I don't think it's one of these. Must be in the actual ASMR folder. Oh, we've got a few. Which is it? I don't think it's those. Oh, there it is. The fastest ASMR. That's the new one. Look at that. So handy. That new camera of hers really does a good job. Alright, let's get to Premiere. Get this thing all loaded up. I love this new Premiere update too. You just double click and bam, it's already filled out all the forms. It even has the right title in. Adobe really knows what they're doing these days. Let's just hit OK, see what we've got, and wow, that's just stunning. I can't believe Adobe's come so far. They fully edited the whole video. Looks like the color grading's been done. I just love it. Absolutely the best editing program I've ever used. Well, it's prompting me to render, so I guess I'll just go ahead and hit export, and then we'll be done with things. Shouldn't take that long. I mean, Adobe's so efficient these days. Just a couple seconds, really. Look at that, it's already finished. Well, everything looks done, but, you know, I should put in at least the bare minimum of effort. We'll go take a quick look at the video, just make sure Adobe did it correctly. Although I have a lot of faith in them, so I'm sure it's going to come out absolutely perfect. But let's take a look, and yeah, there it is. Look at that. Absolutely stunning. It looks smooth. Colors are all correct. Great job, Adobe. Thank you for saving me a lot of time. Now I can get back to looking at some more vests.
Hello. Thank goodness you're here. You seem like you could use some assistance. Am I correct? Make yourself comfortable and welcome to my little shop of curiosities, I suppose you could call it. Oh, no. Please. For you, my services are free of charge. It's an honor to be able to help you today. I've heard so much about you. Well, it's my goal to have you better rested than you ever have been in your entire life by the time you leave here, whether that be late tonight or perhaps tomorrow, depending on how deep of a sleep we're able to achieve, how long your body and mind need to rest. The theory is quite simple. The secret is in deep, deep, deep relaxation. So we will be pampering both the mind and the body before drifting off to sleep, and that will help you achieve a much better quality of rest. We want to be efficient here. So, with that being said, at any time, you are more than welcome, very much encouraged, in fact, to close your eyes, drift off, doze, sleep, whatever you need to do. I will continue my treatment, no matter what, whether you're awake or asleep. I'll let you know what I'll be doing, and that way you'll be able to receive all of its benefits, because we do absorb so much even when we're not awake. Does that sound alright to you? Okay. If you have any questions at any time, you are always free to stop me, ask anything, adjust things. Please let me know what I can do for you and how you're feeling. First off, may I offer you a complimentary sleep coffee? You've never had one before. Well, it's precisely what it sounds like. A sleep coffee is anti-caffeine. This is my machine, and it will negate any effects of traces of caffeine left behind in your system, whether from coffee, tea, even some foods contain caffeine, energy drinks. Alright then, we have two options for brews here. And I can make both with this machine. We have a strong brew and a medium brew. This is our strong brew. Here's our medium. Now the medium brew will remove the traces of the caffeine. And the strong brew will do the same, with the addition of inducing sleepiness. I usually recommend the strong brew if you are pressed for time. Otherwise, I do recommend the medium brew for most people. Okay, that will be best then. And we can always have a cup of the strong brew in case we need it later. Alright. I'm just going to place this into the machine. Close the lid. And we'll put one mug underneath. I'll press the button and we'll let that get to work. Now for a creamer, we offer cream of Cloud Cow. This is the lightest, frothiest cup of sleep coffee you will ever have, guaranteed. Safe for anyone with lactose or dairy intolerances and allergies as well. Very good. Okay, the sleep coffee is finished brewing. I'll go ahead and add that foam. There we are. You can choose to drink the foam off of the top first, or you can let it mix in with your sleep coffee. I will provide you with a coaster so that you can have your coffee right next to you and drink it as slowly or as quickly as you would like. Now, would you like the coaster shaped like bread or the coaster shaped like toast? Hard decision. I'll give you this one. Here you are, your coaster. And your coffee. Perfect. Now, if I may, would it be alright if I ran some tests? They're all quite relaxing, actually, non-invasive, and I just want to get a good understanding of where you are right now. Perfect. Let me turn on my computer here. Okay. All right. Now, if I may, on a scale of 1 to 10, how tired are you mentally? How about physically? Okay. And on a scale of 1 to 10, what would you say your stress level is? Now, is this would be a combination of mental and physical stress. Okay. Do you have a sleep log? I see. I see. Well, please, please, don't worry. You're in very good hands. All right. Would it be all right if I touched your face? I want to feel for any subtle facial tension that might give me some clues as to what treatments would be most effective for you. Wonderful. Good. Perfect. A little bit here. A little bit here as well. Now, my tools. Let's see. Isn't that wonderful? Good. And tracing down. I see. I would like to examine your eyes. Very good. Over here. Good. And here. Wonderful. Okay. Want to tweeze this. Just get this out of the way. Pull, pull, pull there. Pull, pull, pull. And here, just a little. Got it. Go ahead and look at this for me. Follow it with your eyes. Try to stay focused. Try to stay focused. Good. Perfect. And I believe you can go ahead and take 2 of these. These are dissolvable. They should taste quite pleasant as well. They won't make you sleepy or anything, it's just to prime your senses so that you can become more easily relaxed. We don't like to use medical tranquilizers of any sort simply because we want you to be the most well-rested when you leave. And sometimes things like medication that would make you sleepy, you would be left groggy the next day. So, but you can take these. That won't affect your grogginess at all. And then I'm going to need to record your vitals with a few small tests we have here. First, I'll just need you to put this under your tongue, and you're going to hold it there take it from you. Ready? There you go. Like that. Is that alright? Good. Good, good. And while we're waiting for that, I want you to take a look at this page here. Do you see any shapes on this page? They would be a different color than the rest of the dots. They would stand out in some way. You see two shapes. Now what are the shapes? A circle and a triangle. Where on the page is a circle? Here. And where on the page is the triangle? Here. Good. What color would you say they are? Good. So what I would like you to do is just focus on these. Just focus on the shape of the circle and the triangle. Wonderful. Alright then. I can go ahead and take that sponge from you. That's under your tongue. And this I will just be able to send out for test results here. I just have to call them in, and then we'll be able to start treatment. Alright, let's call those in. Hello, McSleepy, sir. Yes, our esteemed guest is here. There are some tests that I'd like to get approval to use, but I was hoping to get your help in determining the concentration of the application. Are you available to fly in? Yes, I will adjust the airspace for proper humidity, yes. Okay, we'll see you shortly. One moment. Better, much better, much better. master in training is going to be here shortly. Well, he'll be joining us to confirm that we go the most efficient route for your treatment. Typically, we can be a little bit more general in what we're doing with our clients that come in. However, in your case, I just want to make sure that we are prioritizing only the highest quality of sleep, the highest efficiency. Certainly, more tests would not harm you in the slightest. It's just simply a matter of time management for you. I know you're so busy. It's understandable, of course. So I called him in because I believe a second opinion is just going to make me feel a bit better. And how are you feeling currently? Are you comfortable? Is there anything else I can get you? Well, do not hesitate. I think... yes. McSleepy is here. I'll have to get him cleared for landing. Just one moment. Hello, sir.
I heard we have a VIP today.
Yes, sir. As you can see, I would appreciate your expertise here.
What tests have you run?
All of the basics, but I was wondering what else may be appropriate here.
I would require a sensation test, followed by a rapid pH and swab test.
Thank you, McSleepy, sir.
Not a problem. I'll wait right here.
All right, then. Now, the sensation test is quite simple. I'm going to show you a few objects and then have you close your eyes. And then you'll let me know which of the objects I had previously shown you you are now feeling on your face. Does that make sense? I can show you the objects here. The first item is a jumbo puff. You aren't allowed to feel it before the test, but you can listen to the sounds and imagine the texture. I would only be touching your face with the actual puff part and not the stick. Then the next item is actually a stick, which is why I wouldn't want you to get confused with this one. This is a conductor's baton. And I would be gently touching your face with this part. The third item is a dry facial sponge. sometimes the texture of this is hard to detect. When we wet the sponge, it obviously becomes a lot easier. And then the final object will be this bamboo hairbrush. The bristles are made of bamboo as well. Okay. Do you remember all of the objects? Right. Then I will ask you to please close your eyes. Close your eyes. Close your eyes. All right. I'll be holding all of them in my hand at once. You ready? Item 1. The bamboo brush. Correct. Very good. Item 2. The conductor's baton. Correct. Wonderful. Item 3. The facial sponge. Item 4. Now, not just by process of elimination. You can indeed feel that this is the giant puff. Good. Very good. Wonderful. We will go ahead and log that information. And then we'll do the pH test. First, I will need you to drink something for me. We have this cup here. Get a scoop. halfway there. Perfect. Now you'll want to swish this around in your mouth like mouthwash. We're just looking for a semi-even coating for the test strip. Alright, here you go. Should taste sweet. Good. Go ahead and swish that around. You can either spit it back in the cup or it's perfectly safe to swallow. Alright. We'll put this under your tongue and count to 6. 1, 2, 3, 4, 5, 6. Perfect. And then the cheek swab. Ready? Perfect, thank you. Now, all of this will be placed in a temperature controlled to-go box, essentially. And that will preserve the integrity of the tests. Just there. pH here. And your sensations test result there. We'll go ahead and close that up. Make sure that it's sealed. Good. All right. Sir, it's ready.
I'll have the results for you shortly. Well done. You're doing great. You're in good hands. And remember, McSleepy says, go to sleep.
All right then.
Up, up and away.
Well, while we await those results, we can start getting you a little more comfortable physically. Are you finding that you're too hot or too cold? Okay. Not a problem. I'll go ahead and prepare this water bottle for you. that will help regulate your temperature. We want you to be at a certain level. That's going to promote the best sleep for you. Alright. Perfect. That's for you. And then we can also go over any eyewear that you might be interested in taking with you. Yes, this is our institution's claim to fame, actually. I would be delighted to present you with all of our latest models. Yes. All right. Here we are. Took the liberty of preparing them before you came in. Each of these are going to help bring some bonus effects that you would receive. And you will be able to take these with you. Can you see all right? Very good. I can go ahead and set these down for you, if that's easier. Okay, perfect. There we are. I would be happy to go over each one with you. Well, you can listen to all the options and then decide which boost makes the most sense for you. Let's begin with the first frames here, these white ones. Now these promote clarity, which will negate any drowsiness afterward, and a very clear mind. Option 2, these smaller circular frames boost memory. These are particularly useful if we do any sleep learning. So anything we would teach you while you're sleeping, you would remember. They're very good time savers. Frame number 3. They're very dark. Now these would upgrade your stealth and obscurity. A bit like you're taking a small piece of the night along with you. Option 4, one of my favorites. These blue lenses are contentment, a true sense of calm happiness with your day. Sometimes we really need that, rather than the constant go-getting. Now, option 5, these increase endurance. With these, you'll be able to go at a steady pace for much longer than usual. Option 6. This pair improves your composure. Very good for when you need to make sure to steady your emotions, like in a high intensity situation. They'll keep that stress at bay. You will need to decompress and unload that stress at a later time, however. Option 7. Now these classes are for enticement and influence. Essentially, your energy from this session will be able to more easily persuade people to look to you for leadership or agree to your ideas. And finally, option 8. These increase pace, energy, and vitality. A little more high-octane gas in the tank, so to speak. But with these, your endurance would remain the same. So now that I've gone over all of the options, do you think any of these in particular would help you the most tomorrow? Perfect. Absolutely. I think that's a good choice. I can leave them by your bedside then. Well, if you change your mind, just let me know before you leave. No problem at all. Very good. I'm getting a call from headquarters. Hello? Yes. Yes. Results. Thank you for being so timely. I see. I see. Perfect. Okay. Soft application it is then. Thank you. Thank you, that's very helpful. Bye-bye. Thank you. Okay. All right. That was headquarters. Sending over your results for the soft application. My favorite treatments, actually. All right. And that will be in folder number 45872. Perfect. All right. Folder. Uh-huh. Carefully, carefully, carefully. Now this folder will be yours now, in case you ever return or need anything. We would have of your information and previous test results to hopefully be even more efficient in the future. I see. Perfect. All right. I have everything I need. I'm happy to say you are now guaranteed the best sleep of your life. I can give you this. You can hold on to it if you'd like. If you're somebody who enjoys holding on to something while they fall asleep, this one's my favorite. But other than that, the last thing for you to do is simply lay back, relax, and drift off into sleep. Now these treatments are top of the line, and they are layered in such a way that will guide you into a very productive and restful sleep and keep you there. I tend to do Hello. I will be your doctor today. Oh no. Oh no, it's you. I swear you weren't supposed to come in for a few months. It's been a few months? Oh my god. Well, you know what they say. Time flies when you're professionally disturbed. Alright, well, let's just get into it, shall we? Well, you're sitting upright, and you're looking at me. Eye contact. Well, dare I say, an improvement. Let's take a look at your charts. Let's see, where did I put that? Right here, yes. An entire dedicated to you. Okay, so, oh, mamma mia. Where to start? Alright, well, I suppose we'll check on that grade 10 heart murmur of yours. Alright. Okay. Breathe in. Breathe out. What's this? The grade 10 heart murmur. It's gone. The rhythm. Breathe in. Breathe out. Breathe in. Breathe out. It's not irregular like a 3 a.m. jazz club. It's normal. Steady heartbeat. Murmur seems to have disappeared. I'm gonna go behind here. Go ahead and breathe in. Breathe out. Good function. Breathe in. Breathe out. No fluid. Okay. Wow. Once more. Breathe in. Breathe out. It's my stethoscope. It's working. It's working just fine. Wow. Excuse me. Alright, well, this is real. I'm here. You're here. You'll have to understand, I'm absolutely flabbergasted right now because last time I saw you, I had to take my 2 weeks vacation almost immediately. Okay, take a look. Blood pressure. Yes, you broke my cuff last time. Okay, I'm gonna go ahead and put this around your arm here. Hold that steady. And then we're just going to get a little reading. Okay. And go ahead and just hold still. Over 80. 120 over 80. Did you hear that? Normal. You're normal. Normal. I can't believe it. Normal. Okay. Your temperature. Why not? We're getting lucky. Okay, here we go. go ahead and hold still. I'm going to get a little temperature reading here. 98.6. This might not be accurate, you know. There's no way, so we'll do an extra test. Yeah, that's right, that's what we'll do. An extra one. Go ahead and put this under your tongue. Hold that there. Yeah. Oh, yeah, you know, you can fool me once, but you cannot fool me. 98.6. Okay. Fantastic. Fantastic. All right. So now that I've gotten some of your vitals, you are not in a current state of active death. Okay. One would say that your vitals are stable. Stable. Have you been experiencing any wheezing? No? Coughing? No? Explosions from either end? No? Okay. How about nausea? No nausea? Okay. Joint pain. I know that. The joint pain is gone. Abdominal pain. I have no abdominal pain. Dizziness. Congestion. Migraines. Not even a headache. Oh my goodness. Well, that's amazing. We'll continue on then. I'm going to take a look at your eyes. Okay. A little jittery here. Go ahead and just look behind me. Your pupils are contracting and dilating as normal. Good. Perfect. Perfect. Okay. Go ahead and look up for me. To the side. Down. And to the other side. Okay. I don't see any redness, discharge, no itchiness, any blurriness in your vision. Okay. Other eye. Go ahead and look up for me. To the side. Down. And to the other side. Great. Great. Go ahead and actually take a look at my finger here, if you can. Right here. Now, can you follow that? Yep. Good. Good. Perfect. Fantastic. And if it were to get closer to you, say we start it right here, and if it just gets closer, farther away, closer, farther away. Amazing. You track that better than a bloodhound. Oh my goodness. Good, 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 good. All right. Go ahead and take a look at my nose. That's right, right there. And tell me how many fingers I'm holding up. 2. 2 again. 3. 4. 1. None. I'm so proud of you. Keep looking at my nose. 2 on both sides. Absolutely. So maybe we can try this test as well. Go ahead, look at my nose. And I'm going to wiggle my fingers. And I'm going to slowly move them out. When they're out of your peripheral vision, just let me know. Good. Let's do it again. Perfect. Incredible. Phenomenal. Eyes are looking great. I'm going to go ahead and put a few drops in for you. Go ahead and look up for me. And look up. Okay. Go ahead and blink, 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 blink. Very nice. Now just look behind. Great. The moisture in your eyes is stellar. Stellar. Let's try the eye chart. Now last time, I don't think that we got past this one. The E. Yes. Good. How about this? Mm-hmm. Yes. Below. Fantastic. Can you do this line? Yes. Dare I ask? C, yeah. Oh my god. Now it's okay if you do. Perfect. Flawless. You didn't memorize these before you came in or anything, right? You wouldn't do that. That's not the case here. Oh my gosh. Alright. So vision has very much improved. I use that very lightly. I don't know what the medical term for this would be. I am simply reeling. Okay, I'm gonna take a look inside your ears next. Have you been having any issues with hearing? Good. How about any ear pain, earaches? And you said no dizziness. Alright, let's take a look here. Alright. And looking inside your ears. Looks uninflamed. Clean. Fantastic. Very healthy. Very, very healthy. And your other ear? May I? Okay. And this side as well. Same thing. No incredibly excruciating wax buildup. No oozing. No crusting. No green infection. Just clear ears. I have the right person, right? Can you confirm your name? Date of birth? Social security number? Okay, I'm going to whisper some sounds into your ears and you tell me what I said to you. You can repeat it back to me. Right. Power. Good. Broccoli. Yes, very nice. Sunset. Triceratops. Yes, very good. Good. it seems like your hearing has also improved. We'll take a look inside your throat next. Yes. Yes, and just about a little up your nose too. Here we go. Go ahead and look up for me. Okay, very good, very nice. I have never seen more attractive nostrils. All right. Now go ahead and open your mouth and say, ah. Wow. I remember last time I couldn't even look in there. It was like, nightmare. It reminded me of that thing from Stranger Things. Alright, but it's not disturbingly inflamed. You haven't been feeling any acid reflux or anything of that nature. Have you been taking your 20 Tums a day? Oh, so we can cut down then. Alright, fantastic news. Okay, next I would like to test your senses. I remember this being a very difficult one for you. Have you been experiencing any numbness, tingling? Good. No loss of sensation. Alright, well, let's put that to the test then. When you close your eyes, I'm going to lightly touch your face, either with the cotton end or the wooden stick end. So you should be able to feel if it is soft or hard. You can also call it soft and pointy, whatever you'd like. I'll get you a new one that just touched my face. So go ahead and close your eyes and tell me if this is soft. Good. Soft. Nice. Good. It's pointy. That was also pointy. Pointy. That was a little pointier than normal. Soft. Very good. Pointy. Soft. Soft. Pointy. Fantastic. You can open your eyes. Flying colors, 100%. Now I'm going to use this bigger one and lightly touch around your face. If there are any places where you can't feel it, you just let me know. Ready? You felt all that? Good, good. Moving downward. Good. Good. Great. Great. Absolutely fantastic. Now, can you stick your tongue out for me? Good. Can you go ahead and clench your jaw? I'm going to try to open it. Oh, jaw of steel. Very nice. Now go ahead and show me your hands like this, palms open. Good. Now can you flip them for me? Fantastic. Alright, now press your hands together like this, and I'm going to try to pull them apart. Great. Alright, hands forward like this. I'm going to push on you. Try not to let me topple you over. I feel confident about this one, that it will not result in me losing my medical license this time. Ready? Great. Very sturdy. Very sturdy. Sturdier than my relationship. Alright. So, the next thing I would like to do is just test your reflexes. And I'm just going to lightly tap your elbows and your knees. So we'll start with your elbow. Just completely relax your arm. Perfect. that so hard? You know? Other arm. Incredible. Okay, now your knees. You felt that, right? Oh, I felt it. I just don't know what to do with all my emotions at the moment. You're so healthy. Okay. Okay. Now, the little smell test. I'm feeling bold today. Go ahead and give the end of this a little whiff. Lemon. Chocolate. Very good. Coffee. Strawberry. Okay, how about this one? One more time, give it a little. Vintage Gucci. I knew it. You're incredible. And so fantastic. Alright, these little flashcards, I want you to tell me what's on them. Okay, just a little picture. What's on this flashcard? An apple. Yes. Okay. And what's on this flashcard? A house. Correct. Now, go ahead and close your eyes. Open them. Close your eyes. Open them. Now, what were on the flashcards? An apple and a house. Yes. It's true. It was an apple and a house. You're correct. So, it seems the last thing we need to do is just give you your booster shot then. I don't know if it was the absolute nuclear cocktail that we gave you that magically cured you. I don't know if a demon visited you. Did you sell perhaps your soul, the soul of the entire world? No? Did you do anything? Don't tell me it was the essential oils. I know. Good, okay. Alright. So, I remember last time I couldn't clean your skin with the alcohol prep pads because you almost immediately had an incredible anaphylactic reaction on my table. However, have you been experiencing allergy symptoms recently? We should try it. I think we should try it. I think we should try it. The moment of truth. I have my epinephrine right here. In case. Ready? Are you sure? Tell me to be brave. Okay, here we go. Your skin looks good. No wheezing. No itching. No redness. No swelling. You can breathe. We'll put the epinephrine right here then. Okay. So go ahead and relax your arm. Just a quick little. There we go. And would you like a band-aid? You're not gushing blood. Perfect. Alright. Well, if you would like one, my nurse can give you any band-aid you'd like. You can have whatever you want. take it. It's yours. It's free for you. I, I am on some sort of high right now that I don't think any doctor has ever experienced in the history of medical. Never, okay? Never. Well, I'm going to have to go update your chart now. It's going to take a while to kind of submit all this paperwork. I'm going to have to, hello, Jess, cancel all my appointments. I am not free. It's great. Bring the champagne, the good one, under my desk. All right, this is going to take a while, but take your time getting your things together. You can check out the front when you're ready. You don't need assistance. You're good. You can just do it. All right, so I guess give me a call if anything changes. Other than that, I'm sure you'll be hearing from the journal. I simply can't believe it. Congratulations. Everything is so right. Goodbye.
Oh, I thought they'd never leave. Oh my god. Well, glad to see you're finally feeling better. Okay. Come on. Get in the van.
Hello. It's Gibi. Welcome to today's video, in which we will be doing a bit more intense ear sounds, ear to ear, sort of shoop shoop type sounds. So if that's for you, sit back, relax, and enjoy. I haven't done finger flutters in a while, so I'll just do a little bit of those. bristles, the nice glittery exterior. Ready? I'm gonna just sort of hold you steady. Haven't done a good ear massage in a while. Hi there, I'm Dr. Gibi. It's so nice to meet you. So this is your first allergy test in quite a while? Yes, okay. Well, welcome back. You called the office because you were having some symptoms that you were hoping to kind of pin down and diagnose, correct? Mm-hmm. Can you tell me a little bit about that? Mm-hmm. Okay, so some dry, itchy eyes. Are you noticing a lot of redness? Is there any sort of like discharge? Any sort of goopy or dry? No. Okay, good. Good. So it wouldn't be any sort of eye infection. How long has this been going on? Did you notice a change when the weather started to warm up a little bit? Okay. Absolutely. And have you traveled at all recently? How are your symptoms there? Okay. Otherwise, have you had any coughing? Scratchy throat? Any rashes? Or red skin? Okay. What about upset stomach? Headaches? Okay. No problem. So I think what I want to do is run a skin test on you just to determine what could be causing this. And have you ever been tested for food allergens? Okay. Do you avoid any foods currently? Okay. But you eat wheat, dairy, soy, corn, any of those? Okay. Got it. Alright. Just going to very briefly look at your eyes, so you can go ahead and look behind me so I don't blind you with this. Okay. Can you look up for me? And to the side. And the other side. Okay. Alright, I think we're just going to be doing a simple skin test. So if you have about 30 minutes or so, we should be able to get you in and out quite quickly. Okay. Alright, so I'm going to have you sit on this stool here. I'm going to go get the allergens. And I'll just ask you to roll up your sleeve, and we can do it on your right arm, okay? Okay, I'll be right back. Okay, so to get started on the test, what I'm going to do is put on some gloves, and we're going to take a look at your skin. That way, if there's anything that's already on there, we don't want to mistake it for an allergic reaction and give you some sort of false positive and have you avoid something that you don't really need to be avoiding. Oh, I see we got the large gloves in the office today. Okay. So, examining your skin. We'll probably just test around the more densely hairy parts, but no problem. I don't see any major redness or rash or anything. Have you been experiencing any sort of skin sensitivity? Okay. All looks good. So we're just going to start by cleansing the skin with an alcohol pad. That way nothing on the skin would, again, give us a false positive by getting into the test here. Okay. Here I have all of the allergens based on your responses. I'm going to be testing you for most likely the top 10, and then we'll have a positive and negative control. We have to wait for this to dry first. Okay. So if you've been having more environmental issues, but we did want to test for a few of the food allergies as well. Definitely going to do 1, 2, 3, test for pollen, test for and these as well. Okay. So we have a bit of the extracts of each allergen in these containers. I'm going to put a few drops of solution into each one to dilute it just enough so we can put it onto your skin for the test. And what we're looking for, just to determine a positive to the allergen, is a very small, probably just slightly itchy sort of hive or a wheal. This will not cause any sort of severe reaction at all. And even if it did, we'd be very prepared here in the office, so truly you have nothing to be worried about at all. Okay. So next what I want to do is I'm going to be drawing out and marking where each allergen is going on your skin so we can keep track of what we're looking at. We're going to use a simple marker, and we're going to make 10 little sections starting right about here, probably closer to your wrist, and then have the positive and negative. So start here, down, so we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, which is perfect because we have the 10 allergens and then the 2 positive and negative. So the positive will be up here, negative here, and then I have the allergen numbers listed. We have allergen 3, allergen 4, allergen 7, 8, 9, 10, 8, 9, 10, 19, 23, 24, 25. Okay. Just like that. So with each Q-tip, I'm just going to give it a nice vigorous rub onto your skin. Oh, we also will be doing the positive and negative. This is the positive, so we'll start with that. Like that. That shouldn't have hurt, right? Good, 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 good. Okay, and then the negative is just using some of this solution. And that goes right here. Okay. Now for each allergen. We're going to go down the left side of your arm and then the right. That's one. Just like that. And then if you do test positive to any of these, we can continue with a more comprehensive test if necessary, or depending on what you test positive to. There are a couple of different steps that we could take. It's an environmental allergy compared to a food allergy. You would have different treatment options. Okay. These three here. And the last one. All right. So just taking a look at what's going on here. I do see that the positive is already showing a little bit of redness, which is exactly what we want. And the negative control isn't showing anything at all. Perfect. Do you feel any sort of itching? Or any sort of, maybe sometimes there's like skin warmth. It could also be from just the friction of the Q-tips as well. a bit of a positive reaction to the pollen, and I think that's what we were expecting, right? Yeah. Okay, and you said you're not on any sort of medication for it? You haven't taken anything for it before? No, okay. Well, I definitely would like to start you on something basic then to see how it goes. We can also schedule you in for weekly or bi-weekly allergy shots if you're interested in that. But otherwise, luckily I'm not seeing any other positives, which is great news. The less that we can be allergic to, the better. All right. So I'm going to bring out a couple of treatment options for you, but first we're going to remove this. And typically if you've ever gotten allergy tests before, you would have to wait quite a bit for the allergen to show up, but luckily with the concentrations we use, it's a bit easier. You get much faster results. Okay, so I'm just going, that was close. I'm just going to wipe off the other allergens first. I see we reacted to the pollen, so I'm just going to wipe off the other allergens first. Get the marker off. And then I'll wipe off the positive test as well, that way I won't spread it to any other part of your arm. Okay, ready? I have a little bit of staining from the marker, but if you want to go to the bathroom down the hall, it should come off right away with a little bit of soap and water as well. Okay, you can put your arm back if you'd like. So first off, there are a couple things that I just want to go over. So you said that you didn't have any issues with food. We only tested for a couple food allergens here today. But I just like to go over with all of my patients. If we're just dealing with a pollen allergy here, it's very unlikely that it would ever make you go into anaphylactic shock. I can certainly prescribe you an epinephrine pen injector if you'd like. I think it's not terrible to have on hand, especially now that the prices are not monopolized. So there are a couple options there, especially if there are people in your life with food allergies. A lot of problems can arise just because we don't receive the epinephrine fast enough. So it's nice when people do carry it on them. So the one thing I will say is you don't want to keep this in your car because there are some temperature regulations with it. The car can get too hot in the summer, too cold in the winter. So you don't want to leave these in the car. You want to keep them in a temperature regulated place. Here is the classic EpiPen. It comes in a case, so this is the case on the outside. You would just pop that open and it comes out like that. The orange bit, it says the needle end because that is where the needle comes out. This is an expired one, and you do want to check the expiration date on these. There are studies saying that they don't lose too much potency after expiring, so if you do have expired EpiPens, you can leave them around as backup for a little bit. So what you would do is remove the blue cap. you would remove the blue cap. And once that blue cap is removed, that works as a lock. So the next step would just be to swing and push firmly the orange tip against the outer thigh so it clicks for 3 seconds, and that will deliver the drug. So you would take this in your hand and either on yourself or whoever needs it, right into the outer hip, and you push it. You'll hear a click. And you count 1, 2, 3. If you want to count a little more, that's fine too. Sometimes when we're in a panic, we might be counting a little fast. It is possible that someone would need 2 doses of epinephrine. And if that is the case, I would recommend, actually very, very heavily recommend that you would inject the next EpiPen into the other thigh. So you don't want to do it into the same thigh. That is something that we've learned fairly recently, so it's good to remind people. Another option that's very popular is the AVQ. This gray one is the trainer, and then this red one is a real one. These are awesome just because of the sizing. You can see the difference. The EpiPen is quite bulky and sometimes a little bit awkwardly shaped to try to fit into like a small bag or a pocket. AVQ fits very well into the front jacket pocket, pants pocket, purse, etc. And for this one, it's about the same. I would pull out the trainer to show you, but it's quite loud. What you do is you pull it from its case, and the AVQ will actually talk to you and walk you through the steps just in case. It's the same sort of deal as this. You would pull out the blue plastic part at the bottom, and then you're able to put it into the side of your leg or the leg of whoever's needing it. So that is my spiel on that. There is a lot of education, I think, being sort of highlighted more recently because a lot of people don't know the correct information about epinephrine. There is almost no side effects. There's really no reason to not use one. A lot of people are very scared to use them, but it's one of those cases where it does matter how fast you get the medicine when it comes to anaphylactic shock. So when in doubt, you can epi and don't worry about what would happen. The other thing is to know that Benadryl cannot stop or prevent anaphylaxis, only epinephrine. So, a lot of times we see people with food allergies using Benadryl to treat their food allergies when in fact that could mask symptoms instead. But the Benadryl wouldn't stop anaphylaxis. If anaphylaxis is going to occur, the Benadryl isn't going to stop that. It would be epinephrine. But there are a lot of times where, you're not going into anaphylactic shock, so you don't always need to use one. If you're interested in more education, luckily there's a lot more information out there, so you can always check my website. For your allergen, I do want you to start on some sort of daily antihistamine. Allegra is quite popular because it's not as drowsy as some of the others on the market, and this should help with sneezing, runny nose, itchy watery eyes, and itchy nose or throat. So this is the 24-hour, so you're going to get 180 milligrams of Allegra. In that, it does come in the 12-hour as well. Otherwise, if you are complaining of the dry eyes, that can be so terrible. I do have some lubricating eye drops I can send you home with today. Otherwise, there are some more concentrated drops, more specific drops, if you're looking for something in particular. These are really easy to use. You just want to pull your head back, open your eye, and drop it in. Comes out just in a couple. Like that. Nice small bottle. So you can carry it with you. Okay. So we can absolutely see how that goes. If you're interested in scheduling allergy shots or anything like that, you can just give my office a call. Otherwise, do you have any other questions for me? Okay. All right, fantastic. Fantastic. Thank you so much for coming in. I'm just going to close these up. Move that back over. It was so nice to meet you. Okay, yes, good luck with everything. And I hope you have a great day. All right, bye-bye. Hello, hello, hello. Welcome to your first appointment of many today. We don't have too much time, so go ahead and sit down. I'm going to start my test right away. I am your neurologist, and I'm going to check your brain. So there's going to be a couple of tests for you. So first, don't let me open your jaw. Don't let me open your jaw. Don't let me open your jaw. Very good. Now, open your jaw, and don't let me close your jaw. Don't let me close your jaw. Don't let me close your jaw. Good, 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 good. All right, you can relax your jaw, and can you stick out your tongue for me? Fantastic. Can you look up, down, side, side? Very good. Okay, look at my nose. Look at my nose. Look at my nose, not my fingers. Tell me which finger is wiggling. Good. Tell me which finger is wiggling. Good. Tell me which finger is wiggling. Both. Good job. You beat the test. Okay, next I'm going to show you a few cards. Are you ready? I want you to memorize these cards. Okay, what was the order of the cards? Bike, apple, sun, house. Very good. Okay, I have two little sticks here. I want you to smell them and tell me what you smell. Ready? Mint. Very good. Bubblegum. Very good. Okay, now I have this stick, and you tell me if I'm hitting you with the soft side or the hard side. The soft or the hard. Close your eyes. Close your eyes. Close your eyes. Hard. Very good. Soft. Very good. Hard. Very good. Soft. Very good. Okay, open your eyes. Your brain is perfect. Hi, I'm going to check your eyes, okay? So go ahead and look straight ahead. I'm just going to check your pupils. Good. Good. Okay, now go ahead and follow my finger. Follow my finger just with your eyes, not with your head. Just with your eyes. Follow my finger. Follow my finger. Very, 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 very good. Okay, go ahead. Tell me, what color is this? What color is this? What color is this? Orange. Very good. And what color is this? What color is this? What color is this? It's purple. Awesome. Okay, so I'm going to go ahead and hold up this eye chart. I just want you to read for me this line. Okay. Good. Perfect. Yes. Good. Oh. Very good. Fantastic. Can you do this line? And could you do this one? Oh my gosh. Fantastic. Fantastic. Do you have any issues? Just a little dry eye? I can give you some eye drops for that. Go ahead and lean back. And okie dokie. You are all set. Your vision is wonderful. Hello, I'm going to be your dentist today. I'm just going to do a little bit of a teeth clean and just check and make sure everything is a-okay. Sparkly sparkle. Alright, so go ahead and just lean back for me and open your mouth. Okay. Do you brush your teeth and floss every day? Awesome. Everything looks really good. So I'm just going to do a little bit of scraping here. Just, naturally we have some buildup, which is why you want to go and get a cleaning every 6 months. If anything's uncomfortable, just let me know. Does that feel okay? Good. Good, 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 good. I'm just going to get one more little tool here and just finish doing the bottom part there. Bottom part there. Everything looks good. And get that black off. Get that black off, You want sparkly shiners. Okay. So, I'm going to do a little bit of floss just to get in between crevices. A little bit of floss. Do you like mint? Everybody loves mint. Okay, I'm going to wrap this around. Say ah. Very good. You have very strong, healthy gums. Even if you can just floss once a day, make a huge difference. Very, very good. Okay, here's a little bit of water. I want you to go ahead and rinse. And you can spit on the side there. Very good. Okay, finally, I'm just gonna do a little bit of fluoride. So with this fluoride, you can't eat or drink anything hot or cold for an hour, okay? Go ahead and open your mouth. And I'm just gonna paint that on there. Fantastic. All right, well, I didn't detect any cavities or anything wrong. So enjoy your clean, sparkling new teeth and go to your next appointment. Hello, I'm Dr. Gibi. Usually I'm a pediatrician, but I just wanted to check a couple things on you today, if that's okay. Very good. You seem like a very, very brave patient. I'm going to go ahead and take your temperature. I'm just going to point this near your forehead, and you just hold still. Perfect. And now I'm going to get your height, okay? Hold that there, hold that there, hold that there, hold that there. Fantastic. Next, I'm going to get your reflexes. So go ahead and relax your leg, and perfect. Relax your leg. Perfect. I'm actually going to check the reflexes on your elbows as well. So relax your arm. Perfect. And relax your arm. Perfect. You have reflexes like a cat. Meow. Okay. Next, I just want to check you for lice. You don't want to spread lice. It is so annoying if you get it. But don't worry. If you do have lice, it means you have very clean hair. If you don't have lice, it doesn't mean you have dirty hair. It just means you're very lucky. Okay, so I'm going to check your hair. Very good. Do you share hats with anyone? Do you look both ways before you cross the street? Do you always wear your seatbelt? Good. Okay, no lice. And then finally, you are due for your little booster, but don't worry, I have Booster Bunny here. Do you go ahead and you can just look at Booster Bunny, look at Booster Bunny, look at Booster Bunny. Yay, all done, you get a Band-Aid. Now, do you want the Hello Kitty Band-Aid or the Shrek Band-Aid? I knew you'd say the Shrek Band-Aid. So I got a little Shrek Band-Aid for you. It says, "What the Shrek" on it. That's appropriate. And I'm just going to put that on your little boo-boo, okay? You were so brave. There you go. On to your next appointment. Hello, hello. I am your allergist. And just a couple questions before we begin. Do you notice that you have any sort of reaction toward any stimulus or in any sort of season? I'm talking dry eyes, runny nose, stuffy nose, cough, wheeze, itching, redness. No? Okay, fantastic. Well, then you probably don't have allergies. However, we are going to do just the sort of top 8 that we see in our office here. Okay, so I do have an EpiPen on hand just in case, just to sort of ease your worries, but we will not need that today. I'm going to go ahead and take a little sterile alcohol pad here, and we're going to do this on your arm. So I'm just doing a little Q-tip test today, so this will not be painful in the slightest. I'm going to take this and just... There we go. And we'll wait for that to dry. I'm going to use a red pen here. And this I'm going to just mark a couple of squares. I'm going to go down and across. And these are going to make squares for me to see what the allergens are. So I'm going to go down and then across. Just like that. So now we have 8 convenient boxes for me. So the first one is pollen. Okay. Second one is dust. Third one is pet dander. Fourth one is eggs. Fifth one is nuts. Yep, all of them. Every single nut. Milk. Soy. And finally, insect bites like bee stings, things like that. Okay, gonna go ahead and take a look. I'm not seeing anything. I think you got off scot-free. No allergies for you. Fantastic news. Well, hey, I'm your physical therapist. Now, do you have any injuries that you'd like me to take a look at? Are you active? Do you do a lot of like sports or activities? Anything where you're like running around, jumping? Yeah, fantastic. Well, I can show you how to wrap your leg in order to make it more stable, especially if you're doing those long runs, anything sort of. Does that sound good? Okay, so what you're going to do is take this, it's very stretchy material, and we're just going to do a little bit of a compression wrap. You're sitting nice and sturdy on this table. Okay, so you can go ahead and stick your leg out for me, and I'm going to wrap that up. Yeah, just like that. Oh, yeah, you're going to feel superhuman. Superhuman. Okay, so now you're just going to cross that back and around and around. And there. Okay, we can go ahead and secure it with these. How does your leg feel? Much more supported, much more supported. Okay, I want you to go ahead and take this stress ball. Go ahead and put it in your hand for me, and I want you to give it a squeeze. Oh, give it a real squeeze. Very good. Go ahead, put it in your other hand. Go ahead and give it a real squeeze. Fantastic. Okay, so I'm gonna go ahead and back up. Now you go ahead and catch the stress ball. You did great. Fantastic. Okay, so lastly, I just want to do a couple little stretches with you here with this band. So we're gonna go ahead and wrap this around your foot, and I want you to hold these two bands and go ahead and stretch your legs out. Point your toes. Flex your feet. Fantastic. Very good. Okay, now I want you to go ahead and wrap this around here. Turn to the side. Turn to the other side. Great, you have very good flexibility. Very good, very good, very good. Now, is there anything else that you're struggling to do? Go ahead and turn your head to the side for me. Move your neck. Move your neck in a circle. Up and down. Okay, fantastic. Go ahead and put your arms up like this for me and turn to the side. Good. Back to front. Turn to the other side. Very, very, very good. I'm going to go ahead and put my hands on your shoulders. Lift up for me. And relax. Fantastic. Well, I think you're doing great. Make sure you always do your warm-ups and your cool-downs and your stretches on the side. But if you need anything else, I'll be here. Hello, hello. I'm going to be your dermatologist today. We're going to be looking at the skin on your face. Before we begin, I'm just going to ask you a couple of questions here. Now, what is your skincare routine? Do you wear sunscreen? Do you wear sunscreen in the winter? Are you lying to me? You should wear sunscreen in the winter as well. And are there any other areas of concern? I'm just going to be looking at your face today, but if there's anything else you'd like me to take a look at. Okay. Do you have dry or oily skin? Do you get rashy? Any allergies? Okay, I think I have enough information. Let's begin. Okay, I'm going to use this little Q-tip. I'm just going to look around the different areas of your skin. Up on the forehead. Very nice, very nice. And under the eyes. Good. Now the area under your eyes is very sensitive, so always be sure to be extra gentle and careful with that. Nose. Very good, very good. Lips, cheeks, side, other side, cheeks. Go ahead and tilt your head up for me. Jawline and neck area looking pretty darn good. Okay, so I could recommend you a couple of products today. Now, your skin is very healthy. There's no cause for concern here. I would recommend a little cleanser, and then after cleansing, you can do a little bit of chemical exfoliation, and then after that, you can do a little bit of toner. Well, in fact, you could actually do the toner first, and then the chemical exfoliation. And then a few times a week, you can start on your retinol cream. This is going to make you live forever. Then you want to do a little bit of a BHA 9 salicylic acid for any sort of stubborn things that pop up. You can just put that on that sucker and it'll go. And then, of course, we need to moisturize, 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 moisturize. If there's anything you take away from this, is that you need to be moister. Finally, I want you to be using that sunscreen on your face, even in the winter. Okay, now, do you have any questions for me? Good. Well, howdy there. I'm your ENT, and that stands for ear, nose, and throat. So go ahead and sit back and relax. And what I'm going to do is just take a little peek, 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 peek up in your crevices. So I'm going to start with your ears. So go ahead and relax, and I'm just going to put this. Look at that. Okay. A little bit of dirt around there. So I'm just going to clean that out for you in a moment. Just a moment. And do you have any trouble? Do you have any trouble hearing? Do you have any trouble with a lot of wax or anything like that? Good. I like what I'm seeing. I'm just gonna give you a little bit of a clean out here. A little bit of a clean out. Sparkly sparkle. And the other one. All clean. So now that you're all cleaned out, I'm gonna do your little audio test, a little audio test. So I'm gonna go ahead and whisper a couple words to you. You tell me what I said, okay? She went to the store to buy lemons. She went to the store to buy lemons. Very good. And this one? He always wanted to be an astronaut. He always wanted to be an astronaut. True, true, true. Okay, so go ahead and open your mouth for me. Say ah, ah. Say ah. I actually do need you to say ah. Good. Okay, you can stop saying ah. Tonsils look good. Or you didn't get any tonsil removal or anything like that? Okay. And do you have any trouble with your throat? Okay, good. Looking in your nose. Gonna go up your nose. Looking in your nose. Ooh, very nice. Very nice little nose holes there. Go ahead and just suction that out. And you are good to go. Easy as pie. Welcome in. I am your cardiologist today, and the first thing I want to do is just get a little bit of information from you. So, tell me about your family history. Anyone in the family suffer from any sort of heart disease or any heart-related conditions that I should know about? And how about yourself? Okay. Next, can you tell me all the medication that you're taking? Okay. And then how often? Okay. Great. Now, have you ever had anything like heart palpitations, chest pain? Okay. So I'm just going to take a listen to your heart here. Okay. And I'm just going to do that with the stethoscope. No surprise there. No surprise there. So I just needed to breathe in and breathe out. Breathe in and breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Gonna go ahead around the back. Breathe in. Breathe out. And now just breathe normally. Okay. Good. Really good. Really good. I don't hear anything abnormal. Your lungs sound great. Your heart sounds fantastic. I'm gonna go ahead and stick this little meter on your finger. It's gonna go ahead and read your blood oxygen level. And while we're doing that, I have this little blood pressure cuff. Do you have a preference for arm? Okay. I'm gonna wrap that around your arm. And just going to read. Good. Oxygen levels look good. Heart rate looks fantastic. I'm gonna go ahead and your blood pressure is great. Alright, everything seems fantastic, which means you are all set to go into your surgery. Hello, I am your anesthesiologist today, getting ready for your surgery. And just before we begin, could I just make sure I have your name and your date of birth? Perfect. Okay, this is a really basic surgery, really safe, and you have absolutely nothing to worry about. So what I'm going to do is give you a little bit of medicine. Go ahead and drink that. Tastes good? Okay, good. Then we have our IV, which we'll put in once you go under, so you don't have to worry about that. And then finally, all we have to do is just attach this here. And I'm gonna go ahead and start counting back from 10. Surgery is gonna be really short, so once you go under, it'll be really quick and you'll wake up in the recovery room and you can go home the same day. Any questions? Okay, so go ahead and breathe in just like normal, and I'm gonna count down. 10, 9, 8, 7, 6, 5, 4, 3, 2. Hello. So you're the patient everyone was talking about. Okay, sit down. Let's see how bad it is. All right, I'm a neurologist, so I'm going to test what's going on up here in that brain of yours. Okay, very important things going on in there. So I'm going to do a couple tests, all right? So first, I want you to keep your jaw closed. I'm going to try to open it. Oh, you let me open it. All right, now that it's open, don't let me close it. Don't let me close it. And I closed it. That's fine. Can you stick out your tongue? Your tongue. Your tongue. Stick out your tongue. All right. Go ahead and look at my nose. Look at my nose. And which finger is wiggling? Okay, let's try that again. Which finger is wiggling? Okay. We'll do a little memory test. How about that? Okay, I'm going to show you some cards, and you tell me what order you see them in. Ready? What order did you see them in? That wasn't even one of the options. What is this? What is this? No. Okay, there's something going on up there. Can you smell these for me? What does this smell like? It's not gasoline, no. Can you smell this one? Not sulfur. It's lemon. It's lemon. Okay. Close your eyes. I'm going to go ahead and touch you with the pointy or the hard side, and then the soft side. So you tell me if I'm touching you with soft or hard. Ready? I was touching it with the hard side. Okay, let's try that again. That was the soft side. I don't think I can do anything more for you. Hello there. Oh my gosh. Okay, let me take a look inside those eyes for you. I'm gonna be your eye doctor today. Okay. Well, that's not good, is it? Okay, go ahead and follow my finger. Follow my finger. My finger. My finger. Can you see this? Follow it. I'll move slower. I'll move slower. Follow it. Follow it. Follow my finger. Follow my finger. Okay. Can you tell me what color this is? What color is this? No, it's green. Can you tell me what color this is? No, it's purple. Eye chart. You'll be fine. You'll be fine. Go ahead and read this line for me. Maybe this one. Read this line for me. How about this one? This. What does this say? Dear God, can you see me right now? Do you know where you are? Well, I'm gonna go ahead and just give you a couple of eye drops. Maybe that'll do the trick. Yeah. That'll do the trick. Okay. Okay. How many fingers am I holding up? I gotta go. Hello. I'll be your dentist today. Let's see what we got. Don't worry. I have military grade tools here, and I'm going to get to the bottom of this. Go ahead and open your mouth. Oh my God. Okay. You know what? Everything's gonna be fine, okay? Everything's gonna be just fine. I don't have ears. Okay, it's fine. I'm a professional. Open. Oh my God. Okay. Hold your head steady. Hold your head steady. Are these your real teeth? Are they? Okay. Good to know. We might need to pull a couple of these. Maybe like 1, 2, 3. 4. Maybe 5. Definitely 6. Okay, that's just a giant cavity. That's not even a tooth anymore. What do you brush your teeth with? Bacon grease. Got it. Okay, well that might pose a little bit of a problem. I'm gonna go ahead and try to get some floss in here. Oh my God. You broke my floss. You drink this. Okay. Oh, Oh, you're spilling. You're spilling. Okay. Switch that around. And just spit in the side. In the sink. Spit in the sink. Okay. Now this is a Hail Mary until I can get you back in here to do some severe dental work. I'm gonna put some fluoride on your teeth, okay? They're just disintegrating. Okay. I recommend you drink some smoothies. Maybe no hard food for a while. Hello. So you are the patient that every doctor is just screaming about. You don't look so scary to me. I'm your pediatrician. I know you're a little old for it, but you know what? They're trying to call in the big guns, and I said, I'm not scared of anything. So here I am. We're going to start by just taking your temperature, okay? So easy. I'm just going to point this at your forehead and take your temperature. Well, that couldn't possibly be right. You know what? Faulty machine does it all the time. Let's just get your height. I can see how tall you are. I would guess about... Well, how tall do you think you are? And how tall were you last year? And how tall were you the year before that? No, that's not normal. Not in the slightest. Okay, so I'm gonna go ahead and check your reflexes. I'm gonna just give you a little... this right on your leg, so go ahead and relax your leg. Relax your leg. Okay, here we go. Are you messing with me? Okay, you better not be. All right, go ahead and give me your other leg. Whoa. You watch it. All right, I'm gonna go ahead and do your arm. Nothing, and a lot of something. Well, you know, we'll get back to that later. I'm gonna go ahead and just check you for lice, okay? Just to make sure you don't have any lice in your hair. Simple check. You know, keep your hair clean. Don't share hats. Don't share brushes, and I'm sure you'll be fine. Oh my God. These are fully grown. Is that a ladybug? What is that? Why do you? Okay, you're gonna need a little bit more than mayo to treat that one. I'm gonna go ahead and write you a prescription strength bug remover. And finally on my list, I just have to give you your booster. Okay? You gotta get your booster. So go ahead and look at Booster Bunny for me. Look at Booster Bunny. Look at Booster Bunny. There you go. See, that wasn't so... Oh my God, you are bleeding. You are... I don't think this Shrek Band-Aid's gonna do it. Oh my gosh. Here we go. Oh God. What in the... Okay, you know what? Nurse. I'm gonna need some more Band-Aids, okay? Shh, close your eyes. Hello there. I am your allergist today. Yes, I am wearing a hat full of leaves in an office full of people who are allergic to trees and things. So do you have any allergies? You do? What are they? Oh, really? I've never heard of that one. Oh my. Okay. Okay, let's do a little test. Okay? I'm just gonna go ahead and get a little prep pad here. Okay. And I'm just gonna go ahead and prep your skin. We're gonna do a little bit of a test. Oh, are you allergic to this? Are you allergic to my prep pad? You're breaking out. Oh my gosh. Hold still. Okay. You'll be alright. A large dose of epinephrine is now coursing through your blood. Are you comfortable with me continuing the allergy test? Okay. Alright, okay. I'm gonna go ahead and draw this on. Just little lines down the... Are you allergic to this marker? Are you allergic to this marker right here? You know what? That last dose of epinephrine should be just fine. We don't have to give you another dose. You'll be... Okay, I am a little bit hesitant to put these on your skin. I maybe should do this in the presence of someone with more revival skills, considering let me just do a little dot of one of them. Oh my god. Oh, we gotta stop that. We gotta stop that. The only thing I have are the alcohol prep pads to clean it off. I don't know what to do. I think that, you know what, this might be better than... Nurse. I need like 7 more EpiPens. Stat, right now. Allergic. Hello there, you poor soul. I'm going to be your physical therapist today, so don't fret. I'm going to therapy your physicalness. Here's a little stress ball. Okay, we're going to start with something easy. There's a couple of fuzzies on it. Don't worry about it. Okay, go ahead and put this in your hand, and I want you to give it a little squeeze. Okay. And put it in your other hand. Give it a squeeze. Oh my god. Okay, alright, calm down, relax. Okay. So, what I want you to do is just bring your arms up for me. Higher. Bring your arms up. Bring your arms up. Up. Okay. And bring them down. Okay. Go ahead and tilt your neck up. Careful. Won't do any more neck tilting. That was dangerous. Go ahead and turn to the side. Ooh, turn to the other side. Oh my god. Okay, I'm gonna go ahead and wrap your body up. I'm just gonna wrap the whole thing. I'm just gonna wrap up your body, give you some support, some much needed support. It appears you have glass bones and paper skin. So we're just going to go ahead and wrap that around you and hope for the best. Okay, you're gonna need to pretty much rehabilitate and relearn how to do everything. Okay, so we're gonna start with this little band. Hold on to the band, and I'm just gonna go ahead and pull and relax. Good. Pull. Okay, you know what, maybe we can start that tomorrow. All right, so go ahead and hop off the table for me. Did you just break your leg? Just take these. I'm gonna need you to leave. You gotta go. You gotta get out of here. It's not safe for you. Welcome to dermatology. I need you to buckle in and strap down because I have heard some things and the fear of God has been struck in me. Okay, I'm seeing things. They're not good things. I'm gonna turn off the light for everyone's sanity here. So go ahead and tell me, what's your skincare routine? Now, I was forwarded your list of allergies, so I'm not sure if any products I have will work for you, but we're gonna try. And, do you wear sunscreen? Okay, because it does look like you may have, the sun living in your room at all times, 24/7, beating down on your skin. That's what it looks like to me. Okay, and is your skin oily or dry? It's both. Extremely. Okay, good to know. I'm going to go ahead and map out your face here. Quadrant 1, traumatizing. Quadrant 2, absolute decimation. Quadrant 3, perhaps able to rehabilitate. Quadrant 3, there's hope. Quadrant 4, I'm losing hope. Quadrant 5, I'm gonna go ahead and put some things on your skin here. Okay, a little cleanser, just a little bit of a cleanse. Okay, we're just gonna try to get you a new face, new skin. We're gonna go full new skin here. Okay, you don't really need this face anymore. You have no use for it. It is not serving you. So we're just going to get you a new one. Now these products are going to start that transformation to your new face. But it's going to take time, okay? It's going to take time, and in the end, it may not work at all, and you'll have to do a full face transplant. All right. Now just a little dab of this. And you're going to feel some burning, some very intense burning tonight. You probably won't be able to sleep, but that's how you know it's working. That's how you know it's working. Well, hey, howdy, I'm your ENT. That stands for ear, nose, and throat. Do you have all of those? Debatable. Okay, now what we're going to do is we're going to go ahead and start with the ears. Okay, so I'm going to look inside your ears with this. So just go ahead and relax. Oh, my excavation. What an holy Mother Mary. Okay, other ear. Okay, I didn't think it could get worse, but here we are. Here we are, aren't we? Alright, so I'm going to start by just cleaning out a little bit of the dirt. A little bit of the dirt. Oh. A little bit of the dirt. A little bit of the dirt. A little bit of the dirt. Little bit of the dirt. Okay, and we're done. Okay, so, I'm gonna use this. I'm gonna use this little guy. Just a little. Go ahead and hold still for me. Okay, and go ahead and hold still for me. Okay, you know what? That's all I'm comfortable doing. We're gonna do a little bit of an audio test. Go ahead. I'm gonna say a very simple word. You repeat it back to me. Ready? I'll say it slower. I'll try the other ear. The word was car. The word was car. Okay, so I'm going to need you to just go ahead and open your mouth for me. Open your mouth for me and say, ah. Are those tonsils? Are those tonsils? They gotta go. Those gotta go. They had to go last year. They had to go last decade. There's no time. There's no time. Say, ah. Okay. Those gotta go. Okay. You know what? We're just gonna take those out. Oh. Okay. They're gone. It's okay. You're fine. Those were a nuclear weapon waiting to happen, okay? So I'm afraid to look inside your nose now, but we must. We must go on. What? Okay. Alright, well, you know what? I think I'm done here. I think I'm done. You need to get to your next appointment, I think. We're gonna go confer with the other doctors on what is happening here. Hello, I'm the cardiologist. I heard there was a bit of an emergency going on with you. Yeah, you're the emergency. Okay, so go ahead and breathe in for me. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Hold it. Hold it. Hold it. Hold it. Breathe out. That is pretty bad. Okay, so go ahead and tell me your medical history. Stop. What medications are you taking? Can you sum it up? Do you have a folder? Do you have a... Okay. Alright, got it. How about family history? Okay, great. They were in a textbook. I see. Okay, great. Alright, let's get your blood pressure. I'm gonna pop this on, check your oxygen levels while I'm doing the blood pressure here. Okay, so I'm gonna go ahead and put this on, this little cuff right here. Put that on. There you go. And I'm just gonna Okay. All right. No, 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 no. Let's check that oxygen level. Okay. You gotta go. You gotta go. They're gonna set up the surgery room for you, I think. You gotta go. Don't worry, you've made it. Everything's gonna be just fine. I'm the best anesthesiologist surgeon combo this world has ever seen. There's nothing I can't handle. Alright, I know who you are. Everyone knows who you are. You're very infamous in this hospital, but please remind me your name and your date of birth. Okay, so it is you. It is you. Alright, I'm gonna go ahead and have you drink this. I'm gonna give you the maximum double dose. Okay, go ahead and drink that. Swallow it, swallow it, swallow it. Good, okay. Now, as that's kicking in, we're gonna go ahead and put in the Ultra IV. Now, this is an IV they usually use for hippopotamus over at the zoo, but I think that's gonna be perfect for you. So go ahead and stay still. There we go. Okay, this is gonna go directly to all your major arteries, veins, and even capillaries. Now, this is gonna be a long one. You're gonna be out for probably the next 3 weeks, but you know, you gotta do what you gotta do. So I'm gonna go ahead and get this started. We're gonna do everything we can. In fact, I'm very confident that when we're finished, you're gonna basically be a new person if you catch my drift. So go ahead and put this on. Okay. Night, night. I'm gonna count back, and you're gonna go to sleep by the time I go down from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You're still awake. Alright, try this. Try this one instead. Okay. Okay. 5, 4, 3. There we go. There we